Please take your seats. The program will begin in 2 minutes.
Our nation's leaders must stand with America's military caregivers. An America where caregivers are empowered, they're appreciated, they're listened to. That's what I want the legacy to be.
I'm a driver, I'm a cook, the bill payer, and I'm a mom.
Caregiving is not like a Monday through Friday, 8 to 5 kind of deal. It's whenever he needs me.
The Elizabeth Dole Foundation has put a face and a name to those who are caring for our wounded and injured service members.
We now welcome to the stage Elizabeth Dole Foundation CEO Steve Schwab.
Good morning. Well, I am just realizing that I'm out here and the lovely words that I'm supposed to be saying to you are not on the screen. There we go. Good afternoon, everyone. I probably could have handled it. I am so honored to welcome you to the Elizabeth Dole Foundation's annual convening on military caregiving. Thank you all for joining us at this defining moment in the movement to support America's military and veteran caregivers, their veterans, and their families. And a special thanks to our wonderful partners at the Department of Veterans Affairs, who have been a key part of every convening and are out with us in force today. Let's hear it for the Department of Veterans Affairs. I would also like to thank our amazing partners who made the RAND study possible. Wounded Warrior Project, Lockheed Martin, AARP, and the Lilly Endowment. And we are so grateful to be hosting this year's convening at Amazon's HQ2. Let's talk about this space, right? This is stunning. From the minute you walked in the front door and saw the alpacas, to coming up and seeing Amazon's smart home, which they were putting the finishing touches on late last night, to all the incredible booths. It's been really just amazing to see come together. When we met with Amazon last year and we told them what we were trying to accomplish, they immediately recognized the importance of and generously offered this space for our use. And in so many ways, the Amazon team has gone above and beyond. Can we give a big round of applause to all the AWS and Amazon employees? We also owe our deepest respect to Tri-West Healthcare Alliance. Tri-West, under the leadership, the incredible leadership of Dave McIntyre, has been a prolific and committed partner of so many organizations in this room. And they've made so much of this work possible. So to Dave and to everyone at Tri-West, a big thanks. We have a lot of other key partners that I want to recognize as well, and they're with us today. Philips, Leidos, Maximus, EMD Serono, who you saw out in the hallway today, and the USA Educational Foundation, who had a line at their booth when I checked last, so they may still be out there. Let's hear it for those great partners. So 10 years ago today, we were at the White House, and we announced the results of an inaugural groundbreaking RAND report on military and veteran caregivers. Never before had this caregiving community been the subject of such a comprehensive study. And the results were frankly staggering. They were also an urgent call across this nation to address a crisis occurring in the shadows to millions of military and veteran families. The study also gave us a blueprint on how to lead a comprehensive national response. And in the decades since, we have turned a mission into a movement. Today, the motto of the Department of Veterans Affairs includes caregivers, families, and survivors. Programs and support across VA, DoD, and scores of other federal and state agencies have been launched and expanded. Countless new national and community-based programs are now working at the side of caregivers to promote their health and well-being. And private sector partners like Amazon are leading the development of innovative products and experiences for caregivers and their veterans. And importantly, providers all across the VA and soon in clinical healthcare settings across the country are being trained on how to practice inclusive care, ensuring that caregivers and their families are integrated into their healthcare teams from day one. And communities across this great country have responded as well. To date, we have more than 200 cities, counties, and states now part of our Hidden Heroes network. And I want to take a moment to thank state and local leaders for raising their hands to lead and launch initiatives that recognize, celebrate, and support caregivers in their communities. 12 years ago, I met this incredible woman, Senator Elizabeth Dole, for the first time. And she shared with me the stories and the struggles of caregivers that she met in the halls of Walter Reed. She had found a new calling, and she knew it needed to start with evidence-based research. I wanted to get going right away, but she thought we needed to get a study done to plot the path, and she was right. This crisis was too urgent not to get right. And without question, the progress that we have made and the transformation that we have seen in this last decade is because a legendary public servant and a selfless American stood up and got it done. Senator Elizabeth Dole, thank you for being our North Star. We salute you and we love you. Okay, so most people at Christmas time don't dream about research, but I do. And today, it's like Christmas for me because we're unveiling our second groundbreaking study with RAND. It's the largest study ever conducted on our community. And it shows us that a lot has changed in the last 10 years. Caregivers are experiencing higher levels of financial and emotional distress. And every single member of caregiving families are feeling the heavy weight of the responsibilities that they have unexpectedly inherited. And as we suspected, there are more Americans caring for service members or veterans than we previously estimated, a lot more. So for all the progress that we have made in the last decade, there is still so much to be done. And as you'll see, this study is a renewed call to action, and our response begins today. Thank you again to Amazon for providing us this incredible forum to rededicate ourselves to the mission ahead. I'm so pleased to introduce our next speaker and our host, David Appel, who serves as Vice President of U.S. Federal for Amazon Web Services. David, we are so excited to be here at HQ2, and we're deeply appreciative of Amazon's commitment to our community. Thank you so much.
Thank you so much, Steve. Good afternoon, everyone, and welcome to Amazon's HQ2. It's truly an honor to have you all here for this 9th annual convening. First, I'd like to say to our military caregivers, spouses, partners, and government attendees, thank you for being part of this significant event. We're so grateful for our partnership with organizations like the Elizabeth Dole Foundation, and are also proud to have supported the Department of Veterans Affairs mission for the last decade. These two organizations, along with countless others in this room today, are working to make a real difference for military caregivers. I'm personally proud to have an active duty Army son currently serving, and have great admiration and respect for everyone in this room who cares for wounded warriors. Amazon also has a deep connection with the veteran community. Just recently, we hit a big milestone, hiring over 100,000 veterans and military spouses. Our Warriors at Amazon Group plays a huge role in supporting veterans and their families. helping them grow their careers and find a community here at Amazon. Once again, we are extremely proud to welcome you all to our headquarters and to be part of the conversation about how we can better support caregivers in the years ahead. Thank you.
We now welcome to the stage President and CEO of TriWest Healthcare Alliance, Dave McIntyre.
Good afternoon. David, thank you for hosting all of us in this remarkable space. On behalf of the entire team that makes up TriWest Healthcare Alliance, I want to say how proud we are of having the opportunity to partner with the Dole Foundation and others to make this event possible. For close to 30 years, we've been working to ensure service members, their families, and veterans have access to high-quality care when it can't be provided directly by the DoD or the VA. That work is a privilege, not a right. And doing it stubbornly as number 2 in line, not number 1 in line, is our mantra. Taking care of heroes, our nation's heroes, is who we are, and it's what we are privileged to do. Thanks to the Elizabeth Dole Foundation, the entire nation now knows what our team has long observed in working with ill and injured service members and veterans. It's that the people managing their care, often most aspects of their daily lives, are their caregivers, their family members, their loved ones. And that's as true in civilian life as it is in military life. They are quite simply all of our heroes. And they are helping in the ecosystem to make sure that people get what they need, when they need it, and how they need it. And it's important for all of us to think about as we engage in this space, how do we flex to that reality? And that is the challenge that was launched at all of us by the amazing Senator Dole. And ma'am, thank you for taking your experience and your time with your loved husband and taking the challenge to all of us to ask us to look in the mirror and join your chorus. For the last 2 years, I've been proud to serve as co-chair of the Elizabeth Dole Foundation Heroes and History Makers Celebration. As many of you know, it's both a joyful and an emotional evening. It helps raise funds for the foundation's mission. Being part of today is a powerful bookend to that gala, which is going to be held in this city on December 10th, because it demonstrates how this organization lives up to the promise that it's made to caregivers, their veterans, and their families, commissioning the next generation of groundbreaking research at its 10th anniversary to inform all of us of the pathway that we need to be on and where the North Star sits from where it is today. I believe that this groundbreaking research and building a nationwide coalition to ensure that America is ever more effective at supporting the most important people in our lives, our nation's service members. They're our heroes, and it makes sense for us to be embracing this moment. To Steve Schwab and the entire foundation team, and certainly to Mrs. Dole and to Secretary McDonald, thank you, sir, for stepping up once again and for taking the helm to lead this great cause. Thank you for inviting us to be a part of this important moment. I hope to see that all Americans, but particularly my peers in healthcare, leaders from every industry in this country and leaders from the public sector on both sides of the aisle, in Congress, in the administration, whatever administrations are serving us in the decade to 2 decades forth, that they join in responding to what we all learned today. Thank you.
Thank you, Dave, so much. We really couldn't be here without Tri-West support. So I'm going to get everybody excited. I mentioned the research is about to happen. So I want everybody to stand up. Just stretch, get ready. Okay, it's like Christmas morning. We used to sit on the stairs, my 6 brothers and I, and wait for Mom to tell us it was okay to go in and see what Santa brought. So we know what Santa's bringing. He's going to bring us a great research presentation. All right, so everyone's gotten their kinks out. Can sit down now. In just a moment, we're going to bring Dr. Ramchand out here. He's the co-director of Rand's Epstein Family Research Policy Institute and the lead author of this study, but I want to just give you a little bit of perspective before we go in. As we learn from Rajiv this afternoon, I'm going to encourage everybody in this room to listen really carefully. Listen to what Dave just said and consider how we as individuals, as companies, as organizations, and as communities can address the challenges identified in this study. I'm really fortunate to have a pretty incredible new board chairman, Secretary Bob McDonald, who talks about how this is going to be the canary in the coal mine, this caregiving issue. And he's right, because it has implications on every single American family. And we can't lose sight of the fact that the numbers in the study today represent real people, our fellow Americans who have sacrificed and continue to sacrifice on our behalf. And among them are our favorite people at the foundation, our Dole Caregiver Fellows, who act as advocates, they act as community builders, and they're fanning out across their states and the communities to get the word out and to help people who need it. And right now, and probably the most important moment of the day, I'd like to ask all of our fellows and alumni and every other caregiver in this room to please stand and be recognized. You, and the thousands who are watching literally online right now, and by the way, we're being broadcast in every VA waiting room across the country, so thousands more. So hi to all the folks who are waiting for their great service from the VA. They are why we do what we do. And this report reveals so many areas of concern. And that means we have to have organized conversations today and come out of here really focused. And so we've done a little bit of thinking, having seen the study and preparing for today, and building 4 pillars or focus areas. They're building and sustaining financial strength and economic mobility, promoting emotional and mental health well-being, strengthening support and improving outcomes for caregiving youth. There's millions of kids from 6 to 18, 19, 20, 21 who are providing primary and secondary care for their parents, and improving the care ecosystem. This is something that Amazon does really well. If you saw that smart home, Senator Elizabeth is like one of the biggest users of Alexa out there. Truthfully, she said that to David Appel backstage, and he was pretty excited. But how we change the caregiving and healthcare ecosystem using technology and other services and supports so that veterans and their caregivers have increased access to the services that they need. Our friends from Aetna and CVS are here, and they're very eager to talk. We were talking about it yesterday. Our goals then for today are to listen, learn, and lay the groundwork for a new plan of action. You know that we're pretty obsessed about plans of action at EDF. So I want to cue a little explainer video brought to us by our friends from Lockheed Martin. It'll preview the study, and then we're going to bring Rajiv out. All right? So get ready.
At a time when America relies on millions of family members and friends to care for our service members and veterans, research gives us the power to understand their challenges. every statistic you'll hear comes from real caregivers,
I know him better than anyone here.
and they tell a remarkable story. The Elizabeth Dole Foundation commissioned RAND to survey military and veteran caregivers across the country about their experiences, their hopes, their achievements, and their struggles.
How you doing?
What emerged is a new and complex picture of Americans making extraordinary sacrifices out of love and commitment to those who served our nation. These are their voices.
When we have these really high bills to take care of, it's very difficult to maintain on-time payments while I've been providing care for my husband.
Hi, this is Colleen Rose. I'm calling about my husband, Gunnery Sergeant Jonathan Rose.
RAND found that many caregivers are struggling financially. Over a third have annual household incomes below about $32,000, the federal poverty level that makes them eligible for supplemental nutrition assistance.
The sacrifice doesn't just happen on the battlefield. You think nobody can understand you. You think you're the only one. Without a voice, you're very hidden.
Compounding the economic difficulties are mental and emotional challenges. Almost a quarter of military and veteran caregivers meet the criteria for depression.
You can do it, Dad. You're strong.
Alarmingly, at least 1 in every 10 surveyed reported having thoughts of suicide in the last year.
My kids are incredible caregivers. It's all they've ever known. Kids are just as much in it as adults are. Their daily life revolves around the veteran.
Almost half of military and veteran caregivers are also caring for a child. And these kids take on tasks well beyond their years, which can result in them struggling in school. And many don't get the mental health care they need.
I'm a lot like a case manager. I am scheduling appointments, following up with the VA, making sure that referrals are going through, messaging the doctors.
I think it's very important that the caregiver is involved in all aspects of the veteran's care so that provider understands what's it like at home.
RAND's experts looked at how well healthcare teams are practicing inclusive care, sharing information with caregivers, seeking their input, and paying attention to their needs. What they found is concerning. Only about a third of military and veteran caregivers reported that the healthcare providers sought their input. And less than a quarter said that their veterans provider inquired about their needs. So where do we go from here? Let's listen together. Let's learn together. Let's act. Our nation's caregivers are speaking.
Please welcome to the stage co-director of the Rand Epstein Family Veterans Policy Research Institute, Dr. Rajiv Ramchand.
Hi, everyone. Hi, everyone. Thank you so much. Thank you, Senator Dole. I'm going to step over here. Thanks, everyone, so much for being here. Thanks to the Elizabeth Dole Foundation for entrusting RAND to do this research again. We did it 10 years ago, and it was just such a thrill to do it again this year, to shed light on America's hidden heroes. I also just want to start by thanking the really thousands of caregivers who took time out of their schedules to talk to us so that we could conduct this research, so we could accurately reflect their experiences. But you've all been stretched, you've all stood up and done your exercises, so now let's get right into the data. Our data shows that there's 14.3 million military and veteran caregivers in the United States today. And just so we're all on the same page, when we talk about military and veteran caregivers, we're talking to individuals who are caring for wounded, ill, or injured service members or veterans, many of whom served themselves, but just for clarity, we're talking about those who are caring for wounded, ill, and injured service members and veterans. We call these Americans, and this is a phrase that the Elizabeth Dole Foundation and RAND came up with 10 years ago. We call them hidden heroes, and we call them this because we truly believe that they're really the backbone of our national security. But oftentimes, their service is hidden, unrecognized, and undervalued. I'll share in detail later how America's military and veteran caregivers are helping our nation's service members and veterans. But this just provides an example of the types of things they're doing. They're helping with mobility issues, so helping people get into and out of chairs. Personal care, helping individuals bathe and eat. Medical care, many are giving medications and treatments. But they're also helping with things like memory assistance. So for individuals who may be experience cognitive difficulties or cognitive decline, they're helping them remember things. They're helping drive them to and from medical appointments. And in places like rural communities, that can be significant amounts of time. They're also, as you saw in the video earlier, arranging for services. A lot of wounded, ill, and injured service members and veterans require a lot of assistance in negotiating that assistance. And military and veteran caregivers are providing that arrangement. And then finally, one that often gets overlooked is they're helping manage symptoms with psychological symptoms. So helping with mood changes that might be associated with depression or triggers of post-traumatic stress disorder. The text. Anyway, so in 2014, we took our first stab at looking at these hidden heroes and really shed light on their experiences. 10 years later, we decided to take a new look at these caregivers. And we did this because a lot has changed in that time period. So let's think about the things that have changed. Troop withdrawal from Afghanistan. How did that affect caregivers? How did that affect wounded, ill, and injured service members and veterans? There's the general demographic shifts, so the aging of the veteran population. How has that changed the types of things that caregivers do? There was also this thing called COVID. I don't know if you remember it, but that had a significant impact on all of our lives, and we really learned a lot about military and veteran caregivers and the experiences of caregivers as more and more Americans required caregiving assistance and many more stood up to meet those challenges. Through our research, we identified 9 ways to better support our nation's hidden heroes. The first is to formally recognize the value. I'm sorry that all these slides seem to have lost the background, but we'll walk through it together. It's totally adapt. As caregivers, you all know, we adapt to things as they change. First, I want to recognize that the value that caregivers provide to society, the cost of this work, and increased opportunities to provide financial compensation to caregivers for the work they perform. In this chart and all that follow, I'm going to show a lot of time data in 2 different colors. So things are going to be in a light green and a dark blue. The light green are military and veteran caregivers who represent individuals or who are caring for individuals who are age 60 and younger. The dark blue are those individuals who are caring for individuals over the age of 60. We find that to be a really important distinction when we start looking at the types of caregiving tasks caregivers are doing, as well as the impact of these tasks. So around 10% of military and veteran caregivers are spending 40 hours per week on their caregiving duty. So what would be the equivalent of a full-time job? We see very few providing, under an hour a week. So most of them are providing somewhat, but you see it really varies in terms of the hours that they're spending per week providing caregiving tasks. But these tasks come at a cost, and the economic cost is quite significant. So our data, we estimate that caregivers are spending on average $8,583 per year associated with their caregiving duties. So this is money that they're taking out of their pockets to help support the service member or veteran that they're caring for. But we also see that they're giving up income or foregoing income. So this might be because they're working less, they've had to cut back on jobs, or they're missing out on opportunities that also provide for some income. We estimate that on average, military and veteran caregivers are foregoing around $4,500 per year in foregone incomes. So this is $13,000 that they have less income per year than their peers that's associated with their caregiving tasks. But at the same time, the value that they're providing to our society is significant, over $100 billion. And we present a very wide range from 119 to 485 billion. And I just want to explain why that range is so big. At the low end, we assume all caregiving hours are compensated at the minimum wage. And in the labor market, some things like driving a person to and from medical appointment might generate the minimum wage. But at the other end, we estimate the cost of a registered nurse in the person's state of residence. Because a lot of what caregivers do are things like administering oxygen or feeding tubes. Those are tasks that can only be done by licensed registered nurses. And so we create this upper estimate. The true estimate of value is somewhere in between, but it really highlights the diversity of what caregivers are doing. But regardless, even at the low end, it's over $100 billion per year. These costs are significant, and especially for those who live in income-constrained households. As you heard in the video, we estimate through our research that 35% of military and veteran caregivers are living at less than 130% of the federal poverty line. And this is not just a number. When we ask people about their financial challenges, they told us about them. So what you see here is that between 50 to 70% report to us that they have difficulty paying bills each month. Around 50% or half of military and veteran caregivers don't have rainy day funds or money set aside for an emergency. And this is really significant, especially for caregivers, because they're the ones who might be most likely to encounter the need for some emergency supplemental funds should they need it. We also estimate that between 25% to 40% of military and veteran caregivers are food insecure, meaning that they're having difficulty in accessing food per year, but that only 25% to 1/3 are accessing SNAP benefits, which is the primary source of respite or support for those who are facing food insecurity. This quote really articulates, and I'm sorry, I'm going to read it to you in case you can't read it. And you heard a quote in the video today, it's financial challenges. If an extra bill comes along and we don't have the money to pay it right away, basically him being a disabled veteran, his pay, that's how he gets by every month. And I don't see how people survive off of that. So caregivers are telling us when we ask them, what's the biggest challenge you face? They're saying things like this. They're saying it's keeping up and making ends meet. So we recommend 2 ways to address the financial challenges of military and veteran caregivers. First, for organizations working with military and veteran caregivers, we recommend that they identify those types of supports that their caregivers may be eligible for, whether that's SNAP or WIC or SSI, identify those types of programs and help them identify that for themselves and then maybe even apply for it with them, support them in applying for it. But we also think that there's an opportunity for policymakers to explore tax credit options. We've seen recently evidence to suggest that the Earned Income Tax Credit, as well as the expansion of the Child Tax Credit, has helped reduce millions of households out of poverty. And the same might happen should we explore those types of tax credits for caregivers. The second of our 9 recommendations is to increase access to mental health and substance use treatment for caregivers and their children. Sorry. As you'll see here, I'm just going to walk you through it. I know this data like the back of my hand. So as you see here, this color over here are non-caregivers. We have caregivers to those over 60, and these are caregivers to those 60 or under. And what you would see if we had the data is that 40% of those caregivers who are caring for somebody under the age of 60 or 60 or under meet criteria for depression. So that's nearly 4 times the rate as non-caregivers or caregivers to those over 60. On the right-hand side, we have suicide ideation. So individual caregivers who have thought about taking their lives in the past year, we find 20% of military and veteran caregivers to those under 60 have had thoughts of suicide in the past year. We also looked at, I'm going to walk you through it again. We also looked at, and this is perhaps most interesting, We looked at the proportion of those who reported that they didn't have time for mental health treatment. So, or rather that they wanted to access mental health treatment, but didn't have time weren't able to access it in the past year. So we see around 37% of military and veteran caregivers to those 60 or under reported that they wanted to see a mental health care provider, but didn't have the time, or didn't see it in the past year. And when we asked them why they didn't want to see a mental health care provider, the majority told us that they had time constraints. They simply didn't have the time for mental health care. We also saw that, and that was really surprising for us, because what we were expected is the barrier to care that we saw among those who were over age 60, where they reported cost concerns were the primary barrier to care. We also see similar findings with respect to our military and veteran children. So as you heard earlier, around 40% of military and veteran caregivers are also raising a child. And what we see is that military and veteran caregivers, the top is around 25% of military and veteran caregiver children have sought mental health care in the past year. But a comparable proportion, around 23%, reported that they wanted mental health care for their children, but weren't able to access it. So we identify different strategies for expanding access to mental health care to meet these significant mental health care needs. But our recommendation doesn't just say provide this mental health care. We're really cognizant of the time constraints that caregivers feel, and how can we offer mental health care and meet caregivers where they're at. And there's some evidence-based approaches that are really worth exploring. Collaborative care is an evidence-based model which integrates mental health care into primary care settings so that people can access mental health care in the primary care environment. Telehealth options could be expanded so that more military and veteran caregivers can receive mental health care in the comfort of their own homes. Asynchronous counseling could be really helpful for those with lower acuity mental health challenges. And what this means, it's basically text-based counseling. So you're interacting with a psychologist or a social worker or a psychiatrist on your own time and on their own time. So there's an agreement about when they'll respond to you and when they'll ask questions. And so that can better accommodate many caregivers. Mobile health applications is another. Some of us have these on our phones already to help us through some mindfulness exercises. Some of them have proven to be pretty effective. And then finally, task sharing, which is providing mental health counseling skills to non-mental health providers. So we're testing it out in libraries in Texas, to what extent we can kind of meet library patrons who have mental health needs. Many are going into libraries because they're stressed out about losing a job and need help finding a job, or a host of other reasons. So we're teaching kind of people within the library to be more aware and strategies to address people who might experience significant stress. And the same types of approaches could be applied to serve military and veteran caregivers. Our third recommendation are to address caregivers' diverse preferences for and needs. And this is a quote. This is really epitomizes it. Oh, sorry. It changed. Okay. This is a quote that epitomizes it. I can tell you my experience has been the same as everyone else, but my experience has been different from everybody else. And anyone who's a caregiver will tell you the same thing. We all have the same experiences, but we all have very different experiences. And I see people nodding their heads. This quote really resonates when we present it to caregivers. A lot of people see agreement there. One of the ways in which they're diverse, and I've already kind of explained to you, is that those caring for individuals 60 or under tend to be very different than those caring for individuals over 60. So I want to dig a little bit into this. One of the ways that they're different, in terms of the size of the population, it's around 26% who are caring for somebody 60 or under, and the remaining 74% are caring for somebody over the age of 60. One of the ways in which they're diverse is their relationship to the person they're caring for. So if you look at the bottom chart first, these are caregivers to those over the age of 60. And you'll see the majority, 42%, are children or grandchildren caring for their aging parents. This has been historically what we've thought of as caregivers. But still, 23%, nearly a quarter, are spouses, and another 22% are friends or neighbors. In contrast, we see a very different profile among those who are caring for individuals aged 60 or under. We still see 24% are spouses, and we still see around 27% are neighbors and friends, but this huge group of other relatives that I would say has been largely unrecognized by a lot of caregivers in the past or caregiving organizations. And what are we talking about there? We're talking about siblings, aunts or uncles, nieces and nephews, cousins who are stepping in to take care. I will notice, we see fewer parents in 2024 than we did in 2014, and we predicted this. And what we're seeing there is that this trend that as parents who are formerly caregivers age, they're not able to take as much care as the caregivers. And we presume that a lot of other relatives, like siblings and cousins, are taking on that responsibility as their parents are no longer able to. They're also really different with respect to the conditions that they're caring for. So I want to really highlight the differences here. So what you see is that older group of veterans, they're more often, 68% of them have been diagnosed with a vision or hearing problem, and 37% a neurological issue. So that's something like dementia or stroke. So conditions that we might associate with aging. On the other hand, among those who are 60 or under, they're caring for individuals who have traumatic brain injury, 21% versus 13%, and a huge proportion of them are helping individuals with substance use or mental health challenges. So these are significant differences. But just because they're different, it doesn't mean they don't exist in the other groups. So we shouldn't turn a blind eye to that fact that 50% of those who are under the age of 60 still have vision or hearing issues, and 40% of those over 60 are still struggling with mental health or substance use conditions. It also reflects this variation by age, reflects in the types of services caregivers want. So when we ask caregivers, what are the types of services you want? The most common one for those caring for individuals under 60 were things that they could do with the care recipient. So things that they could do as a partnership as a caregiving tasks. In contrast, among those age over 60, they wanted help keeping the care recipient safe at home. So this might be in order to prevent things like falls or memory challenges that are associated with older age. So really we see diversity in the age of the care recipient in terms of the programs that might be available to them. So what does this mean? Well, we should think about that diversity when we're tailoring programs to individuals. So we should tailor our program content. So we might want to really address those individuals who need help managing mental health and substance use conditions, but we also want to make sure that we're not neglecting those who are caring for older adults. We also want to tailor our program delivery, the way in which we're offering services. Many who are time constrained might prefer virtual options or telehealth options, but still others might prefer in-person. I'll show you later that use of in-person support groups remains quite high among military and veteran caregivers. We want to tailor our outreach. One of the things that we learned in this study was that people don't identify as caregivers, even though they're taking on caregiving tasks. In our study, the way we came up with our estimate of 14.3 million is we didn't ask individuals if they're a caregiver. We asked them, have you done any of the following 7 things for somebody who has an illness or injury in the past 30 days? That's how we came up with our definition of caregivers and why we estimate that it's so much bigger than the estimate that we came out with in 2014. But what that means for outreach is that we might need to reconsider whether we're saying, hey, caregivers, come to our program. We might want to say something like, hey, if you're a spouse helping your partner remember things, we have a support group for you. And then finally, tailored partnerships. We have really interesting findings that military and veteran caregivers who reported that religion was an important part of their lives tended to have lower caregiver burden, even after we accounted for a host of other factors. So we think that there's a real opportunity for organizations that serve caregivers to partner with religious institutions so that there can be some bilateral learning between the two kind of organizations so that religious organizations can benefit from the cultural competence of serving military and veteran caregivers, and military and veteran caregiver organizations can learn about those who are religiously affiliated and how they can use that type of affiliation to better support military and veteran caregivers. Our slides seem to have changed. So whoever's in the back, thank you so much for helping make our slides look a little bit better. Our 4th recommendation is to expand and promote home health care, considering the ways in which caregivers will be affected. Our research suggests that 53% of military and veteran caregivers have used home health care, so a healthcare provider coming into their home to provide medical care in the past year. We found that was pretty much, a lot of people used it, but spouse caregivers were the least likely to use home health care services. But we also found this really kind of positive finding that those who used home health care reported less caregiver burden. So we were really encouraged that there might be something here with home health care. But as we dug into the research, we learned that we shouldn't just go about promoting home health care as this way that it'll ease the burden for every caregiver. Some of the things that we're concerned about is, will it create additional caregiving tasks? Well, now the caregiver might have to identify which home health care attendant will come into their home. They might have to monitor the quality of care that gets provided in their home. They also may have to assume additional out-of-pocket expenses. So these are things like rails or ramps or anything else that needs to be retrofitted in the home to make sure that it keeps the care recipient safe. And finally, will it create additional work, school, or family disruptions? If you're relying on somebody to come to your home, well, sometimes they get sick too. Sometimes they move or leave their job. And then all of a sudden, that's created a new caregiving task for you and something that you have to figure out, and that might require you taking an extra day off of school. So in this recommendation, what we're really talking about is that as we expand home health care options, we need to be considering caregivers, and the voice of caregivers should be at the table for those discussions. Our fifth recommendation, and we have 9, is to focus programmatic and social support within the context of local conditions in which military and veteran caregivers live. Our data was quite awesome, to be honest. We not only received information from every caregiver in our survey, but we were able to match that information to the county in which the caregiver lived. So we could describe the communities in which caregivers lived. And what we learned was pretty insightful, which is basically that military and veteran caregivers tend to live in communities that are less resourced than non-caregivers. So what you see here is that a greater share of households are in poverty in communities in which caregivers live. There's higher unemployment rates, 4% versus 3%. There's lower median incomes. And then finally, we created an index, we borrowed an index and implemented it, which was called the Child Opportunity Index. And this is an aggregate compilation of the resources in a community, everything from the environmental quality to access to green space to healthcare providers and schools. And what we found is that military and veteran caregivers tend to live in areas where there's fewer resources than their non-caregiving peers. So what we recommend here is that we just need to be cognizant, especially as we learn more about social determinants of health and how the environment and our neighborhoods impact our outcomes. We need to be cognizant of these contexts. It's kind of the notion that if we resource these communities that are under-resourced, even if they're not directed specifically towards caregivers, they might benefit caregivers nonetheless. We heard a lot about this. Our 6th recommendation is to encourage healthcare systems to better integrate caregivers into healthcare teams. We asked individuals how well they felt integrated into their healthcare teams. And you see that there's some significant advances, but there's still some room to go. So most commonly, caregivers said that that the providers that they were seeing sought their input. But this was still only endorsed by around 1/3 of all military and veteran caregivers. We also find that 1/3 reported that providers listened to them when they had something to say. Less frequently were things like frequent communication. Only 14% of caregivers reported that they were frequently communicating with their care recipients or with their providers, and 22%, only 22%, reported that the providers actually asked the caregiver, "How are you doing?" Caregivers are resourceful, as we found out earlier, and they figure out ways to manage this. This is a really kind of fascinating quote. When I started using their terminology, that was respected. I had to do a little bit of reading and research, and then it's like I taught myself, let's try it this way. Let's use their terminology. And when I did, then I got the respect from them where they would talk to me. So caregivers are figuring out a way to better integrate into the healthcare system, but should it solely be on the caregiver's responsibility to do this? Should it be fully on their dime to get up, to educate themselves on the condition so that they can have these meaningful interactions with providers? We also asked on the right-hand side about caregiving hassles. So before we talked about integration, but what about caregivers who might get hassled in the healthcare setting? We didn't see that to be as common, but still it wasn't necessarily uncommon. So 18% of military and veteran caregivers said that they had to remind staff to do something to help care for the care recipient. 17% reported experiencing delays in completing paperwork, and 12% felt left out of making important healthcare decisions. So in terms of how do we promote better integration of caregivers into the healthcare setting, we come up with two broad recommendations. The first is we need research to describe the value of integration. So what I'm meaning there is what are the cost savings? How are patient outcomes improved? How is survival improved? How is hospital stays improved when we better integrate and fold caregivers into the care we deliver? It also could be thinking about demand within the healthcare setting. So if a hospital or a health system is known to be really well integrating caregivers, maybe people start choosing with their feet and start opting to go to healthcare systems that are more inclusive of caregivers. But we also think that there's important avenues for policymakers as well. Earlier this year, they introduced the first CPT codes where providers could bill for providing training to caregivers. It was the first CPT codes to be introduced that provides reimbursement for providers when they're not directly interacting with the patient, when they're interacting with somebody else, in this case, the caregiver. So we should be monitoring how that gets used and considering expanding those types of CPT codes to create an incentive to promote integration. Our seventh recommendation is to promote work environments that are supportive of caregivers. Among military and veteran caregivers, we see that around 50% of them are employed either full or part-time. More among those caring for the younger individuals, but still, if you average it out, it's around 50%. We asked about the types of accommodations they had at their workplace. And so most common you'll see is paid sick days. 69% or 60% receive paid sick days. Unpaid family leave is pretty common. But when we start getting to things like flexible work hours, only 50% of military and veteran caregivers to those under 60, so those perhaps in most need, have flexible work hours. Telecommuting, compressed work weeks, so this means being able to work 4 days a week, perhaps longer hours than 5 days a week. Paid family leave, that's offered by fewer than 50% of the employers in which caregivers, or I should say it's offered to fewer than 50% of all employed military and veteran caregivers. And finally, even employee assistance programs, which could have the potential to help with some of those emotional or mental health needs we discussed earlier, were only available to around 50% of military and veteran caregivers. And it's perhaps because of the lack or shortage of accommodations that we see many military and veteran caregivers experience disruptions at work in part of their lives. So we asked, have you ever had to do any of these, have you ever had to do any of these things to accommodate your caregiving? We see 16% had to cut back work hours, 14% left the labor force early, 12% said that they thought that they experienced discrimination in the workplace because they were a caregiver. So for example, weren't offered a promotion or more responsibility because people thought that they were too busy doing caregiving duties. And 11% fully switched jobs due to caregiving duties. So we really think that we need to figure out how to better accommodate caregivers, especially as we learn about these out-of-pocket expenses and foregone income. We need to think about how workplaces can be more caregiver friendly. And when we make these recommendations, I think what's really important is thinking about the breadth of the work that caregivers do. Many of them work in service occupations. Many of them have hourly wage jobs. And so how do we accommodate caregivers? Things like an employee assistance program could work, but maybe telecommuting isn't necessarily an option for them. So I think we need to brainstorm and get really creative about how to be better accommodating of caregivers in those types of workplaces. Our eighth recommendation is the continued need to conduct rigorous evaluations of these initiatives that are designed to support military and veteran caregivers. We were really surprised. If you look at the bottom of this chart, you'll see that around over half of military and veteran caregivers participated in some type of caregiver program in the past year. So only 38% did not participate, or 48% of the older caregivers to older individuals did not participate in programs. So we saw pretty higher rates of participation than we thought. The most common was structured wellness program. We saw around 50% of caregivers participated in that. That's things like yoga classes or painting classes designed for caregivers. So that might make sense why we see so much participation, but still 38% of those caring for somebody under than 60 participated in a caregiving training program, 30% in an in-person support group, 27% used case management, 19% used respite services, 15% used online support. So caregivers are going to these programs. They want help. They're seeking it out at some pretty high percentages, if you were to ask me based on our past research. But are they benefiting from them? Well, we cross-tabbed those who report high caregiver burden and those who participated in these programs. And what we found is that many of those participating in these programs, between 32% to 51%, still experience excessive caregiver burden. Now, this could be a good signal. This could mean that these programs are attracting those caregivers in the most need who could most benefit from them. We weren't designed to evaluate these programs, but what it could also mean is that these programs are not reducing caregiver burden. Now, there could be a number of reasons for that. It could be they're not intended to reduce burden. But at the same time, we need to evaluate these programs to make sure that they have set outcomes, that they're really trying to achieve something, and that those who are participating in them, who are spending time and resources to participate in these programs, are actually benefiting from them. We've seen a lot of evaluation studies since 2014 that have been conducted that have shown some benefits in terms of lower depression, in terms of reduced caregiver burden. So there is evidence that it exists, that this is possible. We need to make sure that those benefits are sustained for the long term. And then our final recommendation is the need to continue to conduct research that fully captures the full breadth of caregiving experiences. So a lot of times when we think about caregiving or we offer programs to caregiving, we think about things like ADLs and IADLs. And ADLs are activities of daily living. So these are things like helping the person bathe, helping the person into and out of chairs, helping the person feed, eat, necessarily helping them toilet. Instrumental activities of daily living are things to help the care recipient live independently in the community, managing their bills, helping with grocery shopping, finances, things like that. We asked additional tasks that aren't typically considered ADLs or IADLs in our survey. And the most common experiences or the most common activities that caregivers do are not considered either ADLs or IADLs. So 50% of military and veteran caregivers reported that they help remember what the care recipient should be doing. So this is really common, but are we really addressing caregivers who have the need for this support? 61% of those who are caring for under the age of 60 said that their most common task is coping with stressful situations or avoiding triggers of anxiety or antisocial behavior. These are just two, and these were the most commonly reported. So our research recommendation and what we think is a research priority is to better understand and focus on caregivers who are supporting those with mental health, substance use, and cognitive challenges. We need to better understand what that caregiving entails. We need to have it more refined than the questions we asked. And the reason we need to do that is twofold. First, so that we can better understand and make determinations of who should be eligible or who should be served by our programs, but also that we can create content so that we can better serve caregivers with these needs. We can tell them strategies for coping with such stressful situations, or how to help the care recipient who, because of a traumatic brain injury or because of dementia, needs help remembering things. We need to make sure that our services are geared towards what caregivers actually need. I just want to end with this quote. I have a little bit more, but in terms of our recommendations, a caregiver told us this, and it really sticks with me, and perhaps because a lot of my other work is involved in veteran suicide prevention. This caregiver told us, "Here at home, I have to have all his medications locked up in a safe because he has tried to take his life before, and one of the things he has done that with is medications. My biggest challenge is to make sure that he doesn't try to take his own life again. When you read a caregiver who says this to you, you know that they're a caregiver. You know that they're doing things quite frequently. They might not be helping with eating, they might not be helping with bathing, they might not even be helping with grocery shopping, but they're definitely a caregiver, and we should be designing services to meet them. So our report was released today. This is the main report. In our main report, other topics that I haven't had time to go into today, we have, to address this need, we ask caregivers specifically, are you worried about the care recipient and their risk of suicide? And we examine how caregivers in those predicaments are faring. We look at rural-urban differences in caregivers' experience. We provide state-level estimates of veteran caregivers. We look at remote or distance caregivers, so these individuals who don't necessarily provide care in person, but do a lot of their care outside of even the city in which the person lives. But these caregiving responsibilities, even though they're farther away, still creates burden and stress for them. We look at caregiving networks and how many caregivers have somebody that they can rely on to support them. We also examine, in today's political context or in today's actual context, we ask caregivers, do you think that any of the conditions you're caring for could be attributed to the veteran or service member's exposure to environmental toxins? And finally, we look at caregiver sleep quality, alcohol use, and drug use. So all of these topics are covered in the report, which is now available for free to download. In addition to our main report, we have actually 6 products that are being released today. On the top row are 3 original research projects. So most of the data I presented today is in the top left. In the middle, we have a qualitative study. So a lot of the quotes I shared with you today are in that perspective piece where it just shows really in-depth understanding of caregivers. And then we have a separate report that's focused specifically on caregivers to post 9/11 service members and veterans. And for those of you who don't want to read the full reports, and I don't blame you, and you don't need to, we've created a standalone executive summary of our main report, which is maybe 7 pages that distills the key findings. We have a report that describes how things have changed from 2014 to 2024. And then we finally have one research brief that really kind of mirrors my presentation format today that goes through our key recommendations with the evidence supporting them across all of our research reports. So all of that is available today. I'm going to go a tad over, so bear with me. I have 2 more slides. I really just have to acknowledge, I started the presentation acknowledging the many caregivers who took part in our survey, but on the back end, this is just a small sliver of the number of people at RAND who've contributed to this research over the past 3 years. This includes researchers, but it also includes people, communications experts, editors, graphics designers, people who are really helping out at the back end. And I really, am here today because of them, and I'm here instead of them perhaps, but I really just want to acknowledge that they all were just so phenomenal. And I just, to get personal for a second, I began this presentation telling you that a lot has changed since 2010. And one of the other things that has changed that I've become a caregiver, and my brothers and our spouses, to our mother who was recently diagnosed with dementia, and we had to move her down here. And it's been a challenge, and I just thank Senator Dole for 10 years ago really shining light on the needs of military and caregivers. It's been an academic exercise and something I see the value in, but it's become really personal for me now as well. And I just really want to thank Senator Dole for being such an inspiration, truly a North Star, and also thank my mother, who's taught me more about caregiving, especially in the past 2 years, than any of the research I think I've done has taught me. So thank you all so much. Thank you. I think I go back there. Thanks.
Thank you.
Please use the QR code or visit bit.ly/2024-convening-survey to leave feedback on today's program. Please welcome to the stage Elizabeth Dole Foundation Chief Operating Officer, Elizabeth Field.
Thank you. Thank you. It is so wonderful to see so many people here today, and I think Rajiv Ramchan and his team deserve another round of applause for that incredible research and work. We at the Elizabeth Dole Foundation really view the report that is just being released today from RAND as the roadmap for our work for the coming years, maybe even the next decade. And throughout the day, you're going to hear more about the work that we will be doing related to the 4 key focus areas that Dr. Ramchand just outlaid: the mental and emotional wellness of caregivers, the financial well-being and economic mobility, the need to make sure we're truly practicing inclusive care, and that we're supporting our youngest caregivers, military and veteran caregivers. I have the true honor this afternoon of introducing Senator Tillis. Senator Tillis is a leading voice on the Senate Veterans Affairs Committee, not to mention many other committees, and perhaps most exciting for many of us here today, he hails from the great state of North Carolina, the home state, of course, of our very own Senator Elizabeth Dole. He, prior to joining the U.S. Senate, was Speaker of the House in North Carolina, where he led a lot of work focused on job creation policies, as well as tax and regulatory reform. So I think we know that if he was up to that task of tax and regulatory reform, he is more than ready to take on the work of supporting military and veteran caregivers. So please join me in welcoming Senator Tillis to the stage. Thank you. Thank you, please. Well, Senator Tillis, I want to, again, thank you for joining us today. I know you have a very busy schedule and there's a lot going on in Washington right now. But I'd like to start with giving you an opportunity to speak directly to some of the caregivers who are in the audience today, not to mention the thousands who are watching online, including in VA waiting rooms. We know from the research, and we also know from personal experience, that many of these caregivers feel underappreciated, unseen. Sometimes they have feelings of isolation and don't want to ask for help because they are focused so much on caring for their loved ones. So what would you like to say directly to them?
Well, first, thank you. It's difficult. Excuse me, it's personal, it's difficult. I mean, it's so challenging. Thank you for doing it. I know it's not easy. We need to help out. I got a call last week to see if I would be able to speak on the panel, and I have to say to my staff, I was yes the minute I heard it was from Elizabeth Dole. And so the answer was yes. What's the question? Also, well, with Elizabeth Dole, you need to understand that's the smartest approach because you're going to end up there anyway. And so thank her for her tenacity and her track record for caregiving. You know, it's very difficult, and in fact, it was interesting last week because I was in the mode of a caregiver myself. My mother had a stroke last Monday. MRI indicated 2 strokes. 92 years old on October the 4th, very healthy, living independently. She had the good fortune of calling my brother, who immediately got 911 there because she said she wasn't feeling well. Within 45 minutes of her feeling symptoms, she was getting the stroke buster drug, which really reduced her symptoms. But now she is in rehab. So I left DC yesterday and was a part of the brothers and sisters who were there with her nonstop while she was going through the hospital, and I'll be back there this weekend. So when I tell you the experience is fairly current, it is. And you all are so much more so, but we're going through the same journey that many of you are going through. It's trying to strike the right balance and make the right decisions. And it can be a very difficult decision because sometimes what your instincts will tell you as a loved one are not necessarily the best choices for the patient. And so thank you. It's hard, it's terribly complicated. It can be draining, but it's life-changing. So thank you for doing it.
Well, we're very sorry to hear about your mother and hope that she has a good recovery.
Based on my conversation with her last night, she's doing okay because she's getting all over the staff and the physical therapist for telling her not to stand, not to sit. She was like mimicking them while I was on the phone, talking trash with them, which is a good sign.
Okay.
I could spend a whole day telling you about my mother and caregiving. But.
Well, wonderful. Turning to your other role, not just son, but a member of the Senate Veterans Affairs Committee, and for several years, I imagine that you have seen a bit of an evolution on the committee in terms of recognizing who military and veteran caregivers are and supporting them. And so I was wondering if you could talk a little bit about how you have experienced and observed that evolution and why you think it's so important for this committee to focus on caregivers.
Yeah. When I joined the Senate, incidentally, I'm occupying the seat that was previously held by Elizabeth Dole. And Senator Dole, I don't know if I've ever told you, but I actually named a dog after you. I did. I did when I was not in politics, but if you're from North Carolina and veterans' well-being is not on your agenda, then you're asleep at the switch. Mm-hmm. 1 in 10 North Carolinians are veterans. When you do the multiple of veterans with family members, it's astounding. Dan Sullivan and I have this thing going where Dan always says, I've got more veterans per capita than any state. I tell Dan Sullivan, I've got more veterans than you have people. We have over 1 million veterans in the state of North Carolina and growing. When we were in the legislature, I tried to focus to the maximum extent possible on making North Carolina the most military and most veteran-friendly state. And when you focus on that, you realize, excuse me, where the deficiencies are. And caregiving is first among them. And what we have to do is make sure we have the resources there to educate people on caregiving. There's a lot of people with good intentions. So, we can talk about the obvious policy priorities, right? We need to have the resources to make sure that they can just make the numbers work, because this can be very expensive. It can be draining just in terms of time. And so we have to figure out, it's not a one-size-fits-all, it's not one federal policy, it's not one state policy. It's really the whole of all governments and the private sector, along with the family members who are caregivers, in many cases, to really try to do the best thing for the veteran. And that's why when I came to the Senate, I said I have to be on Veterans Affairs Committee. The only two committees that I requested were Veterans Affairs and Senate Armed Services. I understand that that's considered odd, but I made it clear to Mitch McConnell if I couldn't be on those committees, that I would just work off the committees and then try to get on in the next Congress. That's how strongly I felt about these issues. And fortunately, I was on them and have been on veterans for 10 years. And it's absolutely one of the most rewarding committees, because you gotta work really hard to make this issue political. And there are people that work really hard to make every issue political over on Capitol Hill. So it's nice to really see, for the most part, us come together and not have to dread going to a hearing because somebody's going to make politics out of caregiving for veterans. So it's a great committee. It's getting a lot of work done, but we have a lot more work to do.
Wonderful. We were talking a little bit backstage about the fact that before you were a U.S. Senator, you were the president of your PTA for your daughter's school. And I can imagine, as a parent, that might have been the hardest job you've ever had. That's right. That's right. I can imagine. Yeah. And we just heard from Dr. Ramchand that about 40% of military and veteran caregivers are also caring for a young child, and that those children really have a lot put on their shoulders and can sometimes struggle. And so what would you say to military and veteran caregiver parents who are trying to support their young children at the same time as they're taking care of maybe their spouse or their parent?
First off, education is key to me. I started a caregiver journey in 1997. Many of you wouldn't know my background, but I was a late bloomer academically. I didn't finish my 4-year degree until I was 37 years old. I was in a high-tech field. I ended up getting a job, moving to New England, making money, kind of didn't finish school till I was almost 37. But But as I was finishing some of my final credits to graduate from University of Maryland, my grandmother was diagnosed with early onset Alzheimer's. She was only about 71 years old. And I observed my mother and her two sisters trying to provide care to them, and intuitively, I felt like they weren't doing it quite right. And since I had some semester hours, I went to University of Maryland for 2 courses. One was caregiving for Alzheimer's and dementia patients, and the other one was dealing with death and dying in the grieving process, because most people who have studied Alzheimer's or dementia know the most profound form of grief is the loss of oneself. And we see veterans who are going through that today, those with traumatic brain injury, et cetera. So that really started my journey back in 1996. And it's instructed me all along the way. And what I believe very strongly, that education is critically important. These children need to, on the one hand, be consoled, but on the other hand, as they get older, be educated on how they can participate in it and make it a positive experience. In the same way that I ended up having a remarkably positive experience with my grandmother as she continued a cognitive decline that lasted nearly 5 years before Alzheimer's took her life. And so educating these young children, Sarah Verardo, who's a friend of mine from the Independence Fund, has done an extraordinary job with her children. And I think having that support system which better prepares them for it, and actually taking the load off the parent as being the spouse, as being the only one who are preparing these children for the role, I think is critically important. And then again, education for the caregivers. I do believe, as my mother and her 2 sisters loved my grandmother and would move heaven and earth for her, but it was intuitively clear to me that they weren't providing her the care that she needed. And so I, as a third party, I think one of the things that the spouses and family members need are, third parties that are willing to engage and help them really, help them have a better experience for themselves and the caregiver. It's still going to be a tough job, but I think education and anticipating, understanding things, contextualizing the challenges that they're going to have only come through really studying the issue.
I think
you got a decent grade on those courses too.
Fantastic. I think the extent to which you have personal experience with caregiving is really remarkable, and I think it's something that all of us in this room appreciate in terms of how it informs your policy making. So I appreciate you sharing that with us. Another topic that you have spoken about publicly is the financial struggle that you and your family experienced as you were growing up, and we know again from the research from RAND that many of our military and veteran caregivers are unfortunately struggling financially as well, many of them below the poverty line. And so what do you think Congress can do, and what do you think state and local governments can do to support military and caregivers financially when they need it?
I think it's going at it from the standpoint of, let's go back and see what's working and not working. In my office, when anyone requests a meeting about trying to get federal resources for a state initiative, a nonprofit or government entity, I've told all my staff, I don't make value judgments about programs. If there is a federal program that a state entity or nonprofit is qualified for, we're going to do everything we can to get those federal resources to that entity. Now, I'll also say I apologize in advance if at some point I vote to cancel that program, because I think there's a better and a better, more efficient way to provide service delivery. So I think one of the things we have to do is go back and look at the current programs and ask ourselves, are they as lean and as productive as they can possibly be? And anyone who's a caregiver has probably got a long list of personal experiences where lean and productive are not used to describe either federal or state programs. So the first question we have to have is, if we want more net resources to go to caregivers, is we have to ask that question. And it defies logic. I spent the majority of my career, I was actually a partner at Price Waterhouse before I finished my 4-year degree. I spent a lot of time with a lot of business, tens of thousands of hours over the course of my career, advising on you can't get modern unless you modernize the foundation of whatever your business is doing. So we have to have that discussion. Now, there are going to be a lot of people saying, look, you know, nothing good happens when government changes things, which is generally accurate. But I think we have to go back, just like, you know, the discussions I had with former Secretary McDonnell about how do we actually improve things, put money to a better and higher purpose, streamline things, modernize things, use technology in a more sophisticated way so that at the end of the day, we're spending more on a per patient basis, but we're probably spending it differently.
Wonderful. I think we have time for about one more question, and I would like
my answers are long.
No, they're informative. I would like to give you an opportunity to tell us about some of your legislative priorities on the committee or elsewhere, particularly legislation that you think would benefit caregivers and veterans alike.
Well, one thing we have to do is fix a bill that I voted against after having spent the majority of the effort to have the underlying bill exist, and that's called the PACT Act. How does this relate to what you all are doing? Because 2 years ago, after my office worked on TEAM Act that was in the bill and on Camp Lejeune Toxics Act, I voted against it. And the reason I voted against it 2 years ago was one of only 9 members. And I wasn't like a spectator. We were actively involved in that because we moved it forward too soon. And now what we're seeing in a hearing last week, but in news reports 2 months ago, $3 billion shortfall in the current quarter and $15 billion shortfall. When I voted against that bill, and I was talking to veteran service organizations that I still have a good relationship with, I said, guys, it's not ready for prime time. And at the end of the day, veterans will be harmed by this. Now, if you have a mandate to move forward with the letter of the law in the PACT Act, and you have a shortfall, then whatever you have the discretion to claw back loses. And that's what I was trying to say. Lines are longer. Programs that affect caregivers could now be affected because we did not, I shouldn't say we, others did not have the courage to say, of course I want to support veterans. But sometimes you have to stand out there and recognize what on its face looks like it benefits veterans is harming them. And that's precisely what's happening with the PACT Act, which is why we got to go to the table. We got to fix that, and we've got to find other ways to free up resources. It is a difficult job to be a caregiver. It's even more horrible when you're hanging on a 1-800 line forever, or you're going through some sort of an appeal, or you can't get in touch with an expert that's helping you. Hopefully, if you're in North Carolina, you're going to my office because we've got a pretty good batting average with cutting through the red tape for constituents in North Carolina. But we've got to get people to focus on that. Don't do it because it's easy and you don't want to get questioned by the Veteran Service Organization. If you believe in your heart of hearts, it wasn't ready for prime time. We could have fixed it. It could have been a matter of law in the Congress that it would pass, and we wouldn't be dealing with a $15 billion shortfall right now, which I believe will end up affecting really the whole of the VA, or I should say VA beneficiaries. So just be smart, be honest, be productive, and do the right thing by veterans.
Well, the PACT Act is certainly an area of focus, I think, for many people in the room here today and those watching. So we will continue to watch this space and to follow your work in the Senate Veterans Affairs Committee.
We have to fix it, and you know, I've said it's not enough for me to have been right in my prediction from 2 years ago. But we have to realize that we have some fundamental problems that we need to fix. And if we invest the time, don't succumb to political pressure, do the right thing, do right by veterans, we'll be able to resolve it. But that's critically important. But again, I assume many of you, if you're here, you know, you're in a tier in terms of people invested in caregiving. But back in your respective states, get to your congressional members, do everything you can to get them to help you if you're going through challenges. And if they're not being responsive, then call my office. Because we'll be a third senator for your office if you're not getting the support that you need. It's that important to me.
Wonderful. Well, you heard it here first. Wonderful. Well, Senator Tillis, we cannot thank you enough for coming this afternoon, joining us, sharing with us not only your wisdom, but your personal experiences. I think it means a lot to everyone in the room, and I know I speak for Senator Elizabeth Dole, that it means a lot to her as well. So thank you again, and please, another round of applause for Senator Tillis.
God bless you.
Thank you. It is now my distinct pleasure to introduce Congresswoman Miller Meeks. Since 2021, Dr. Miller Meeks has represented Iowa's 1st district in Congress. And you're right, I did just say doctor. We're going to get to that in a second. She is on Veterans Affairs, where she serves as chairwoman of the Health Subcommittee and has spearheaded several bills in support of military and veteran caregivers. Of note, Representative Miller Meeks comes from a military family and knows personally what it means to serve. Her father was a master sergeant in the U.S. Air Force, and she herself enlisted in the U.S. Army at age 18, serving for 24 years as a private, a nurse, and eventually an ophthalmologist. So please join me in welcoming Congresswoman Miller Meeks to the stage. Thank you so much for coming. You're welcome to have the podium or sit. It's up to you.
I don't know if I should sit, but I'm not going behind the podium for very obvious reasons. I know I saw there was, there are dogs that are in the Capitol, so I was going through Longworth yesterday, or not yesterday, but last week, and there was someone that had a dog. I think the dog's name is Sammy, and so I decided that if I had a dog that looked like me, it would be a corgi, fat body, short legs. So as I scurry through the Capitol. It's a pleasure to be with you all. Thank you so much. And I'm here a little late, and I want to explain to you why I'm a little late. So as I was going from the Senate side of the Capitol Visitor Center from one meeting with our rural electric co-ops to a meeting with orthopedic surgeons who are in, there had been a woman walking in the hallway in Longworth and who stopped at our office because, and I can't do this without getting emotional, so I apologize, and I don't think it's weakness. Outside our office door, we have Back the Blue, Stand with Israel, and we have a poster of the 13 Gold Star families that were created in the disastrous withdrawal of Afghanistan. I promised I'd never forget them, and I won't. So it just so happened that right as I'm coming back and to start this meeting so I could get here on time, the person that was walking in the hallway was the mother of one of those Gold Star service members, the only Army, and I happen to be Army. And she was so moved, went into the office and asked to see the member of Congress who was still honoring her son. So Paula Knaus Self, the mother of Ryan Knaus, the only Army member killed at the bombing of KIA. And I will tell you, this is my 4th year in Congress. And of all the things I have ever done, and if I come back or not, the most important thing I did today was to take time with that mom. I don't apologize for it. I just want to explain it to you and thank you for your patience. And I will never forget. And then I next want to say to you, this foundation, the Elizabeth Dole Foundation. So first and foremost, my husband's family is from North Carolina. I go to North Carolina a lot. A paragon, a giant, true giant, Senator Dole, I think was one of the first women to serve in 2 different cabinet positions as Secretary of Transportation under Reagan, Secretary of Labor under Bush. I think she was the 2nd woman president of in the history of the Red Cross, and then a senator from the great state of North Carolina. Those are awfully big shoes to fill, Senator Dole. You are a role model and inspiration, and so proud to be here and address you. So thank you. And not that your husband's chopped liver, that's not what I'm saying. The other Senator Dole, but thank you so much. With that, I think it's better for me, given that votes may be called shortly, that one, I want to express our help, our support for community care. So I was a nurse before I was a doctor. Was stationed at Walter Reed, met a young man who was an E6 nurse working on ENT and oncology. I worked on neurosurgery. I did not want to go to neurosurgery when the Army, in its wisdom, assigned me there. I wanted to do emergency room, operating room, or pediatrics. I got neurosurgery. I have flipped many striker frame, taken care of a lot of young men in halos, and in the ICU, and in what we now would call traumatic brain injuries. And my husband was on the other side of Walter Reed, and both of us, as we were trying to get our careers, I was trying to go to med school and went into nursing so I could work at night to go to med school. He was trying to get his education, so I was the first of 8 kids ever to go to college, first to graduate, only one to med school. My husband is the second of 9, still the only one in his family to have ever gone to college and finished college. So we both cared for military members actually as jobs and part-time jobs. My husband did that in Maryland. I did that in Texas. And it is a true calling, and it's the highest thing we can do, is to care with compassion, with patience, and with understanding, especially of our servicemen and women. It is sometimes in the quiet times and the quiet hours, late at night or early in the morning, where people will convey to you some of the trauma that they've experienced. And so not only are you helping to heal them physically, but you certainly may help to heal them emotionally, spiritually, and mentally. So thank you so much for all that you do in caring for individuals, and especially our veterans. And with that, perhaps I'll take questions. Don't be shy. Thank you for that. So our support for community care, the work that you do, is tremendously important. We know that our peace dividend at the end of the Cold War was that our military strength would be made up half from active duty, half from National Guard and reservist. And it's a little bit different. So my dad was Air Force, so I grew up around military bases. We would spend Armed Forces Day, 4th of July, almost always on a military base, being scared out of our wits when the medical tent would have the giant syringe. But it's very different when you're using reserve, when reserve and National Guard are utilized to deploy overseas. If you recall, it wasn't until George Bush that active duty or active duty was supplemented with reserve and National Guard. And I remember the big fervor from all the states saying, you can't take our National Guard troops, they're supposed to help us with this flood. And that was part of the peace dividend. So what does that mean? It means that these members don't go back to a military post or base. They don't go back surrounded by other members in uniform, and their spouses, their family members, don't go back to this built-in community where other people know what you're going through, where other people have been through that. So there's this support mechanism that exists when you're deployed and then you come back to a post or a base that does not exist when you go back to a community. So I grew up in La Crosse, Texas, a town of 893 people. My dad was stationed at Lackland. So imagine if you leave that small community, you're deployed overseas, and maybe it's multiple deployments in a combat zone, and you're coming back to a town of 893 people. And the nearest healthcare facility is 30 miles away. And no one knows what you've been through. No one knows what you've experienced. You know, it's so critically important that we have care for veterans where they are. That's our duty. And to me, that's one of the things that we have to continue to push the VA on, is to acknowledge the Mission Act, to get veterans care. If they can't get in with 30 days, it is not okay on the 29th day to call up and say, oh, we've made you an appointment for 29 days from now, and keep punting the ball down the road. That is not okay. It's not okay that the VA thought that residential mental health care or substance use disorder did not fall under the Mission Act, and they didn't have to get people in within 30 days. I can tell you, even though addiction medicine is not my specialty and I'm not a psychiatrist, if you're at the point where you want treatment for substance use disorder and you think mentally you're at the point where you are suicidal or you are a danger to somebody else and you are asking for residential mental health care, why would the VA not think that that falls under the Mission Act? And until our hearing, they did not. It's unconscionable to me. But that's why what you do is so important, because you're working with veterans in a community, in a home, in places where they reside, looking around, what's the support that they have? How do they interact with their family members? How do the children see them? All of that is critically important to their healing and needs to be brought back to the VA and to the work that you do. So to say that I'm a huge advocate of community care and our caregivers would be an understatement. We're going to continue to focus on that. We're going to continue to push the VA on this issue, because I think for us, our veterans deserve no less than care where they are, in their community, with people who can support them. And part of that is also, in supporting the family, you help to guide them how to support their own family member. So to me, it's just so very important that we continue to push the VA in honoring the Mission Act and community care. And what you're doing, I think, is just priceless. So thank you for that. Thank you for the care you give our veterans. You know, when people raise their right hand, they raise their right hand, they swear an oath, and they sign on the dotted line. And they know when they sign on that dotted line that they may be putting their life on the line for this great country. The least we can do is honor their willingness to sacrifice with the best care that we can give them where they are mentally, and in their community, trying to help get them the support that they need, and that includes supporting their family members. And that's what you all do here. Thank you. Okay, I'm sure that generated one question somewhere. Well, it's an interesting little thing, like on the way to the forum. So, you know, sometimes people in their exuberance and trying to make things better make things worse. Now, what do I happen to be talking about? You're talking about benefits. I'm talking about a little thing called a kiosk system. Anybody know about a kiosk system? How many of you have heard complaints about the removal of the kiosk system? Okay, so, you know, I generally appreciate the fact that people within the VA system thought that they could make things better and more efficient. Why the hell didn't they talk to veterans? Pretty simple thing. So we spent all this money trying to do an online system that veterans can't use and can't access. And guess what I just heard last week we're going to be doing? Putting back in the kiosk system. So to your point, I think that that's valid. You need to, you know, one of the things you learn both as a nurse and as a doctor, and that is to assess. So you take information from a variety of sources, what an individual tells you, what you see, nonverbal communication, what people around tell you. You take all of this information, any testing, you put it together, you make an assessment, and then you make a plan. Maybe what they should have done was to find out at this point in time where veterans are, how many veterans we have of a certain age, you know, is that the best system to put, rather than I'm 35 years old, I think this is really cool, we're going to implement this and do that. Do the assessment first, make the policy second. And first and foremost, if it's for veterans, check with veterans. They'll tell you, I can tell you where they meet for breakfast, where they meet for lunch, when they have their monthly meeting. check with veterans before, and then we have a myriad of veterans organizations. I'm sure that the American Legion and the VFW and Disabled American Veterans and the Purple Heart Veterans and the Wounded Warrior Project and all of our great veterans group would have given them an earful had they bothered to listen, which would have said, veterans access the kiosks, don't get rid of the kiosk. You can morph and gradually change to another system, but first and foremost, make it a system veterans can use and access because it's for veterans. So great question, thank you for that. All right, I'm gonna have to go. Senator Dole, thank you so much. You are truly an icon and inspiration. Thank you for all you've done to help me and my career. Thank you all for being here. Most importantly, thank you for the care that you give our veterans each and every day.
Thank you so much, Congresswoman. Thank you so much.
Please welcome to the stage Wounded Warrior Project CEO, Lieutenant General Walter Piatt.
Well, thank you, Congresswoman, for all your support for our veterans. For me, at Wounded Warrior Project, I'm reminded every day that war is humanity's worst invention. But it takes good young men and women from our nation, the best of America, to wage it, because the alternative is unacceptable. But too often in the course of that service, their lives are impacted, and warriors have to face the end of the life they thought they were going to have and embrace a life they never thought possible. And that's for the entire family. Because the hardest part of surviving is living. It should not have to be this way. Warriors should be able to find another path through the love and care of their caregivers, a new path in life of hope and renewed purpose. One warrior who faced that, he was the only son. His father died when he was young. He dreamed of being a professional football player, but after 9/11 joined the Army. Mother begrudgingly gave up her only son to the Army. Well, one day in Iraq, his platoon was attacked, and badly. His vehicle was blown up, and he laid inside wounded, and his platoon unable to get him due to heavy enemy fire. When eventually he was evacuated, everyone thought he was going to bleed out and would never survive. He was in a coma. 3 months later, woke up at Walter Reed. His mother by his side. He didn't know who she was. He couldn't speak. And through the love of the mother, a caregiver, he got his treatment at home. And he learned to write again. He learned to speak again. He learned to hope again. He learned to love again. And through all that care at home, through caregivers and the love of a mother, the most powerful medicine you can probably have, he became a football coach. He got married and has 2 sons that play football. The love of a mother, the love of a caregiver is powerful, powerful medicine, but it needs to be so much more. It should not be harder to come home from war than it is to go to war. But sadly, it is, and we all struggle to get home. We may be back, but we're not home. That home requires the love of a caregiver that has to accept the end of the life he or she thought they were going to have with their loved one, now to embrace the life they didn't think possible. But it can be done. It can be done through the support of this organization and this study. We have 2 powerful things now behind us. This wonderful study, although you fell short and didn't mention the love of alpacas that do required in the sealing process, I've been given a lot of ribbons in my military service, but the one I got today about I love alpacas, I'm going to hold dear. Who'd have thought? And we have the force behind a very powerful soul in Senator Dole, who is a force and a saint. We can't fail. We must not fail. This study will show the data and realistic. I did not need a study to know how bad this problem is. But America needs to see it. America needs to see in this study the true cost of our freedom is still being borne out by the caregivers and the warriors who fought to keep this nation free. 21 years ago, Wounded Warrior Project started by simply stuffing backpacks and giving them to warriors who were evacuated to Walter Reed that didn't even have the shirt on their back. But we also made a promise that we would be there no matter what. This study is no matter what, and we will keep the promise. Thank you.
Please welcome to the stage moderator David Ebbets, caregiver and survivor Sean Moore, and esteemed panelists Keith Hawk, Samantha Gonzalez, and Amy Goyer.
Good afternoon. How's everyone today? Steve made y'all stretch. So I'm a former Army guy. Are we good on our push-ups for today? All right. So we're talking about economic empowerment. And you saw the data from Rajiv earlier, and I think anyone, not just a caregiver, but anyone, financial matters, economic upward opportunity is something that you don't always think about, but yet it's present in almost every situation, every conversation. It's a bit like gravity. Sometimes it can really weigh you down. Sometimes you can bust through and be really empowered by it. And so I'm really excited to bring this panel to this group today and lead a discussion for the next 35, 40 minutes. So the one thing I also love about this group is when we said, all right, like how do we introduce the group? They said 30 seconds max, let's get to the conversation. It was like my kind of group. So I'll introduce quite quickly here. Samantha Gonzalez, she's a Deputy Staff Director for Senate Veterans Affairs Committee under the ranking member, Jerry Moran, the senior senator from Kansas. And she works on that staff, which is big into caregiver legislation, specifically the Mission Act. Keith Hawk leads Department of Stateside Military Operations at the University of Maryland Global Campus. Colonel Hawk is retired, and he's focused on everything to do with military as it relates to UMGC. Sean Moore is Elizabeth Dole Foundation Caregiver, Director of Caregiver Support Programs, and very focused on financial readiness and education with Elizabeth Dole Foundation. And lastly, Amy Goyer leads the Family and Caregiving Expert. She's an author, speaker, and a consultant for AARP, which is huge in the caregiver support. My name is David Ebbets. I lead the USAA Educational Foundation. We do financial education for the military, and we're proud to partner with the Elizabeth Dole Foundation to create financial education specifically built by and tailored for what caregivers need. And so let's jump into it. So we all just heard the data from Rajiv. What really stood out for you as you sat there?
You're going to make me start.
I did.
Okay. How many hours do we have for this? A lot of really interesting things, and a lot of things that are very distressing. The number who are living with low incomes, the food insecurity really struck me hard. I mean, no one should be hungry in this country, much less our veterans and their families. The mental health issues, I hear this a lot from family caregivers, that they are struggling with their own mental health, but they're focused on those that they're caring for, so they put themselves at the bottom of the list. So those are just some of the things that jumped out at me.
I would say more than any one finding or recommendation, what stood out to me is just how the depth and breadth of the issues facing the military and veteran community, how diverse of a community it is, how many issues and challenges are facing those in the caregiving space, and how many opportunities there are in big and small ways to really make a difference.
And I was struck by the scope of everything that was presented, but what really touched me was, I believe it was the 5th recommendation that talked about the need for tailored and community level approaches, because every caregiver journey is unique. There's a lot of things that they share, but every journey is unique. And it really stood out to me that the research, despite all that scope, was able to hone in on that in terms of every caregiver needs tailored, personalized support as they go through this journey.
Well, I lived this life, so it was not surprising to me in my support of the many caregivers in our organization. We live this every day, and I know for those caregivers in the audience, you're not surprised with the research and the findings as well, because you live it. What we need to do is take those recommendations, all of you in the audience and watching online, and do something about it.
Absolutely. I think as you look at all the recommendations, the 9 recommendations that were talked about, you see how money or personal financial stability or instability or job, which can lead to fulfillment, all of that kind of is interspersed through that. And they all they're not just individual recommendations, it comes all the way through. That's the biggest thing that I took away. Sean, you mentioned this. Like, you live this day to day. You see the ground truth from caregivers. What do you see as, unpreparedness for their financial future, or if it's financial instability? What are you seeing? What are some of the tools that caregivers and veterans that you work with? How do you help them?
Well, at the Elizabeth Dole Foundation, we have a financial wellness program that consists of a critical financial assistance program for the caregiver to apply for. Many of our veterans are very proud and they don't want to ask for help, and that is where the caregiver comes in. But many of the programs out there, the veteran has to apply for first. They have to sign up before the family even gets support. These family members oftentimes come to the table wanting support before they're veteran. So at the Elizabeth Dole Foundation, if you, as a caregiver, need critical financial assistance, you apply. Another thing that we're really looking into and doing is we have to make sure that we are preparing for our financial future when caregiving ends. I said this just the other day to our fellows. It's a stark thing to think about, but caregiving will end. My caregiving journey ended about 7 months ago. And had I not been preparing financially for that end, I would not have been able to put food on the table for my kids. I would have been worried about staying in my home. I would worry about so many things had I not prepared for it. That is the one thing that I want to make sure that at the Elizabeth Dole Foundation, we advocate for each and every caregiver to be able to survive once they become a survivor. I don't believe we're doing enough about that. We don't think about it. We don't give caregivers the tools to be able to do that. Those that are offering employment opportunities, I hear a lot. We do great things in the military spouse space. Not all of our caregivers are spouses. And when we are not being inclusive to each caregiver's journey and who they are, they're going to be in a world of hurt when caregiving ends. So all of you that are businesses, organizations, we need flexible hours in employment. You need to understand that sometimes we need to take our veterans to the VA or a different doctor. We need that flexibility. I am grateful to the Elizabeth Dole Foundation because I am a remote worker, so I could prepare for when caregiving ended. You've got to think about that. If you're a caregiver, if you're a family member, if you're an organization, if you're a corporation, we need your help.
Absolutely. And as the USA Educational Foundation, we looked at who we could partner with. The Elizabeth Dole Foundation was a great partner because of the way that you thought through the challenges. It has education that helps you build far left to that event of, where you really need it. And then it also provides the support net of if you need emergency financial assistance, you're there to help them. And I just love that full spectrum approach that you lead. So thank you. Amy, Rajiv's just shared that caregivers spend an estimated $8,500 in out-of-pocket associated costs for caregiving, and then that almost 130% are living at the federal poverty level. Given your personal and professional expertise in this area, talk to us about the cost of caregiving.
So I will share that I was a family caregiver for my parents and my sister. My dad was a World War II veteran of the 10th Mountain Division. We may be familiar with the 10th Mountain Division with our beloved Senator Bob Dole. My dad came in as a replacement officer as well during that journey, and he served during the Korean War as well. He was then a college professor. He did not stay in the military, and when I began caring for him when he developed Alzheimer's, he had never availed himself of his VA benefits. So I had to get him enrolled in VA healthcare and eventually got aid and attendance and various benefits for him, but it took a long time, it was complicated, and I had multiple people I was caring for. Long story short, I moved across the country, kept 2 homes going, paid the mortgage, and in fact, ARP's research around the cost of caring shows that the largest chunk of what caregivers are spending money on is household expenses. You might just automatically assume it's medical expenses. It's not. Paying the mortgage, paying the rent, that's what I did. Paying for home modifications to make the home safe. Maybe there's a grant they can get, maybe there isn't, maybe they don't know about a grant they can get. They are paying for medical expenses. That's the next biggest chunk, around 17%, let's say. More than half are paying for the home expenses. But then there are also personal care expenses. In the statistics go, it's a smaller chunk, like 11%. But for us, that was my highest expense. Because when you think about someone with dementia or someone who has other serious injuries who can't be left alone, and we as caregivers are trying to work to shore up our own financial security and future, how do you do that? You have to have help. These days, a home health aide is costing around $33, $35 average across the country per hour. And that adds up, $75,000 a year, and you saw that data about household incomes and annual incomes. How do you do that? My parents didn't have that much, and they had planned. They'd done a lot of really good things. So these things add up, and you're also paying for entertainment and recreation and all of the extras, things that actually make life worth living, that are quality of life. So we're paying for all of these things. For me, I ended up, after more than 12 years of caregiving for multiple people and lots of complications, but I'll share with you that I ended up in bankruptcy. And I am a caregiving expert, and believe me, I had every support that I could, but I had lots of challenges with trying to keep all these balls in the air. So no caregiver should have to give up their own financial security. We all deserve financial security, our veterans and their caregivers. And I think that's why we have to really think about, okay, how do we lower these costs? What are the things we can do? Well, we've got some really good things in place. A lot of people don't know about them. So one of the main things we need to do is connect the dots for family caregivers. Employers need to be involved in supporting them through employee resource groups. ARP's been working a lot with them. Make sure that they know what supports are out there. We have, of course, the VA Caregiver Support Program, absolutely critical. We have the VSOs who are helping in various ways, but we also have community organizations. We have area agencies on aging that might be giving some supplemental services. So I think it's like a big puzzle, and you have different pieces that kind of fit together to make your unique situation work in terms of costs. And we've got to get rid of any silos. We got to make sure we're telling each other, about what we have to offer. ARP has a bunch of publications. We have a financial workbook for family caregivers. We have a home modification benefits guide. We have a health benefits navigator. Let's make sure that caregivers know about that. And that, through all of the programs that you're all involved in, that we know about what you have. I moderate a Facebook group for family caregivers on Facebook. It's 20,000 people, and a lot of them are veteran caregivers. And so I'm always sharing resources in there. If you've got something great, let me know about it.
Love it. Thank you. Thank you. Samantha, we know that you and the VA committees in both the House and Congress are working hard on economic mobility issues for veterans and caregivers. Tell us about some of those initiatives.
Yeah, there's several pieces of legislation that we're working on that I think speak in a variety of ways to the findings and recommendations in this report. So one that is near and dear to my heart and Senator Moran's heart is the RESPECT Act, and this was based on feedback that we heard from caregivers themselves in Kansas and across the country. Sean, you were one of them, so I have to give you your due credit there. And what the RESPECT Act would do would make it easier for veterans who have mental health or neurological conditions to go through the assessment process for VA's family caregiver program. We know that they have some unique needs, and we know that VA sometimes when they're assessing veterans and caregivers for this program don't take those needs into account the way that they should. So it would simplify that process and make it easier for veterans and caregivers to hopefully be enrolled in and get the support that program provides. And it would also expand mental health care opportunities for caregivers themselves, because I know it's not news to anyone in this room who lives this life every day how hard it can be to be a caregiver. And right now there are opportunities through VA for caregivers to get their own support, but we heard from a lot of caregivers that they don't feel comfortable getting that support from VA for a variety of reasons. They don't want to take an appointment from a veteran, and so this would expand opportunities for caregivers to get that kind of support that they so desperately need outside of VA. Another bill that's of course near and dear to our heart is the Elizabeth Dole Home Care Act, and that's an excellent bill. It's been rolled up into a bigger omnibus, the Elizabeth Dole 21st Century Healthcare and Benefits Improvement Act that we're really hoping to see enacted before this Congress is up. And that would make a variety of changes to VA's caregiver and long-term care programs. VA's really got a menu of options for veterans and for caregivers as they age, but too many veterans, as Amy was saying, aren't aware of all of the services and supports that are available, and it's way too difficult to figure out what those services are, how to take advantage of them, how to piece them together, since everyone's situation is unique and different. So would hopefully expand a lot of those opportunities and make those programs work a lot better. And then one that probably is specific to the goal of this panel of looking at economic well-being and financial wellness is, I call it the 3R bill because the name is kind of a mouthful. It's the Veterans Re-Education, Reemployment, and Retirement Act. So as I think Sean and Amy both said so well, that's an area I think we really have a lot of work to do of making sure that we're making it as easy as possible for caregivers to be thinking of their future. What does life look like after they're no longer needed as a caregiver? Are they re-entering the workforce? Are they planning for retirement? There's a lot of work that we want VA to do to help caregivers be thinking and planning for that, to give them access to employment assistance programs, to help them if you're leaving a career where you have a professional certification or licensure, how can we help you keep that up while you're caregiving so that when that is over, you're prepared for whatever that future looks like. So that's one piece of legislation I'm really excited about.
Thank you. Let's talk about education. It's one of the biggest stepping stones into kind of upward economic mobility. We know that caregiving is not a 9-to-5 job. Keith, you live in this space every day, and you meet with military families, you build programs around that. What can caregivers do to help with education, and what can then educators do to help connect with caregivers and provide that economic opportunity?
So thanks for that, David. I'd really like to address the second part of that. And, to me, You know, Amy talked about cost and all of that, and when you look at higher education, it's not a financially insignificant undertaking. You know, short of getting married, having children, buying a car, that's probably the most expensive thing pursuing higher education that somebody's going to take on. So at UMGC, at our institution, you know, we're a public state institution. We spend a lot of time talking to employers about those kinds of issues. And when I look at what it is that we need to bring to the table in terms of higher education, I really break it down into 3 areas. You know, the first one, and we get this a lot from employers, is the importance not just of the degree, but the skills development that underwrites the degree, whether that's a degree, a credential, whatever it might be. And are we able to deliver, as an academic institution, are we able to deliver what it is those employers need? I think that's tremendously important, certainly for a caregiver, but really for any student. You know, the second piece in terms of how I think higher education needs to contribute to this is what I call meeting students where they're at. You know, you talked about, you know, caregiving is not a 9-to-5 job. Well, higher education typically structures itself in terms of a 16 to 19 week academic term built around the fall and the spring. That does not serve well, you know, adult students who are trying to pursue higher ed when they have other significant responsibilities staring them in the face. They don't have time to go to class from, you know, morning and until night for 16 to 19 weeks at a time. So I think higher education needs to look at how do we meet that population where they're at in terms of, are we flexible as far as start dates? Do we have multiple start dates that they can undertake? Are there policies and processes and procedures in place that when a caregiver needs to take a break because of a caregiving or a family responsibility, they're able to do so? And I would also say higher education in terms of meeting students where they're at, we need to be flexible in terms of how that student pursues their degree. It may be that they don't need a degree because the skills they're after lend itself simply to an academic credential that they would take and then go back, pursue whatever they want to pursue, and then potentially come back to higher education later on. And then the last thing I would say, you know, as the third of the three, you know, Sean, you talked about, you know, financial readiness, you know, and I think a lot of what higher education needs to deliver is the skills that enable that financial readiness when they move forward into whatever that future looks like. You know, at our institution, you know, we're deeply proud of a scholarship program that we have for caregivers. And we've been blessed to have a number of Dole Fellows participate in that scholarship program. And one of the things that we have heard from them, and I was not surprised to see it in the study, is the importance of higher education as a means to be able to support a family and to basically have that not just a job, but a career that enables mobility, enables growth, and enables, you know, quite frankly, the ability to earn a family-sustaining wage. So in terms of the degree, obviously the degree needs to deliver those skills. But I would also say higher education has an obligation to prepare students, any student, but certainly caregivers, for how to make that career transition as it comes about. You know, how do you write a resume? You know, how do you go through an interview? How do you tell your personal and professional story as a caregiver so that an employer not only understands that you're not the right person for the job, you are the person for the job. So I think, you know, those three things, you know, skills development, meeting students where they're at, and then enabling that career growth and that career progression. I think higher education certainly has an obligation to the caregiving community to try to deliver on that.
Thank you. So wrapping up here, last question. You each have a magic wand. What's the one thing that you would do to ensure that caregivers have financial strength and economic mobility going forward?
Magic wand, okay, just one thing. I would want legislation passed for tax credits for caregivers universally. There is, right, yes. I know ARP is pushing the Credit for Caring Act, which would provide a $5,000 tax credit for working caregivers. we need more things like that, state level, federal, I think those tax credits, as the research indicated, are one way to get there to help with that financial economic mobility.
I'm going to build off of Amy's excellent answer and say I would enact each of the bills that I spoke about earlier. I think they're not the magic bullet solution by any stretch. There's still a lot of work that we have to do in this space, but I think that would go a long way towards supporting caregivers the way that they deserve to be and need to be supported, and helping to get us one step closer to solving a lot of the great findings and recommendations in the report.
And I'm going to build off what Amy and Samantha said. Because what we see, at least what I see in my role in higher education, is I see cost sometimes as a significant impediment to a caregiver's ability to do what they want to do. And we saw the statistics from the study. So if I had a magic wand and I could just wave it, it would be the ability to take that cost issue off the table so the caregiver could go pursue higher education as a means to whatever their career and professional goals are.
If I had a magic wand, I know that there are many caregivers that want to work, yet, again, they're not provided the opportunities that they need to either stay in the workforce or get back into the workforce. We all, a lot of us, switched to remote work during COVID. You all know you can do it. So make those opportunities for our caregivers to be able to work from home, have those flexible hours, so that they can provide not only for their family. Many of the caregivers that are in the room and are online, their veterans can't work. They cannot. When a veteran passes away, most of that money is gone that the veteran was bringing in. My household is negative $8,000 per month. Per month, immediately. If we are not giving opportunities for our caregivers to work and provide for their family, and then their families after the veteran passes away when the benefits are gone, we have more caregivers that are homeless. We have seen caregivers and their children living in cars because they were immediately kicked out of their homes. Each one of you here has a responsibility, not only for the veteran, but the entire family, the children in these homes. How would you feel if you had to tell one of your children that they couldn't play sports or play their musical instrument after one of their loved ones, their parent, died, and they can't even do that? That may have been the one thing that was holding them together. We have to make sure that our caregivers can work, provide for themselves when caregiving ends, because it will. And this is an important, emergent situation.
Thank you, Sean. Thank you, panel, and thank you, audience, for the time today, and look forward to hearing more of what your ideas are coming out of this session. So, thank you.
Thank you.
Please welcome to the stage Executive Vice President at Booz Allen Hamilton, Dr. Kevin Vigilante.
Well, thank you so much. It really is an honor for me to be here today at this convening. And I'm really proud to say that Booz Allen has supported the Dole Foundation since day one. And I know some of you may have been out in the exhibit area. You may have seen the Caregiver Community Map, a machine learning tool that we helped develop for the Dole Foundation so that they could offer more customized support to caregivers living in specific counties or zip codes. But at this point, I had a whole speech prepared this weekend, and yesterday I was at a luncheon at the Dole Caregiver Luncheon, and I was so impressed with the words of Kara Benson, the Dole Caregiver Fellow. I don't know if Kara's here, but she moved me and a lot of other people. And I feel like I need to go in a different direction. And I've listened to many caregivers over the years. And when you listen to them, one theme that comes through again and again and again is the devastating impact of shattered dreams. Everyone has hopes and dreams. I have mine, you have yours. It's what animates us. It's what propels us into the future and sustains us. Dreams for ourselves, our family, and our children. In our dreams, we're all happy, we're healthy, and life is good. But what happens when those dreams are stolen from you? When everything you thought about the future turns out to be wrong? When your loved one is suddenly disabled, depressed, and unable to work? When every waking hour of your life is spent taking care of other people, and there's not a single moment to take care of yourself, and all the time wondering, how are you going to pay the bills? Nobody dreams of this. When I hear caregiver stories, I sometimes think of the words in a Bruce Springsteen song, The River. He asked the question, is a dream a lie if it don't come true, or is it something worse? And sometimes it is something worse. Losing a dream is like the death of a loved one. The future you thought would be yours, but is now gone. And you mourn the loss of your future life. And sometimes you give up hope. But that is why the Dole Foundation is so critical. It comforts caregivers in their darkest moments and helps them create new dreams and new possibilities. And there's nothing more important than hope. Without it, life is unendurable. When Elizabeth Dole encountered young families suffering from the loss of their dreams over a decade ago in Walter Reed, she saw the darkness that enveloped them. But she is not one to waste time cursing the darkness. Elizabeth Dole lights candles. And the Dole Foundation is like a giant bank of glowing candles, illuminating the way forward, rekindling hope, and restarting lives for so many caregivers. All of us are so inspired by the courage and tenacity of our hidden heroes. And they're not asking for much, just the right to hope and the right to dream. And all of you in this room help make those dreams possible. And you, along with Senator Dole, Secretary McDonald, the Dole Foundation, make the light shine brighter for caregivers, their veterans, and their families. So thank you for all you do, and God bless you. Now I'm getting to my real task here, which is to introduce a very bright light indeed, Kentucky Dole Caregiver Fellow Lynette Kennedy Durham, who you'll hear from shortly. She's one of the incredible Americans devoting their lives to the care of those who served. And thanks to our incredible partners at WETA, you're about to see a piece of Lynette's caregiving journey. I'm so excited that we have the opportunity today to premiere for the first time anywhere a short from the upcoming PBS documentary, Caregiving. You'll hear more about this exciting and important project later from Richard Bland, WETA's president, Foundation and Government Development. But for now, please turn your attention to the screens and let's listen to Lynette's story. Thank you.
Good morning, Dad. Good morning. You doing okay? Good morning. I had a dream just recently where some people came to get Dad, and they said that I wasn't taking really good care of him. They took his bed out with him in it, and I was begging them not to. I cried so much that I woke myself up crying.
You remember I told you today I'm going to be going to New York for Jordan's graduation? Junior and Kim and Caprice are going to be taking care of you while I'm gone, okay?
You know, I'm going on vacation Monday, and we'll stay through Sunday, which is the longest time I've been away from Dad. I can't even remember.
Just every time you turn him for the hip daily, you know, just check it and just make sure it looks okay.
I'm excited because I love New York. I haven't hung out with my older sister in a while. I get to see an old friend while I'm in town. And sleep. I get to sleep through the night. So all those things are wonderful. Will I relax? I don't know.
Can you just hold the phone up to his ear?
Sure, I will.
Okay. A little bit nervous about leaving him.
You know, he's well taken care of.
Oh, that's not it. Afraid he's not going to remember me when I get back. Like, remember he didn't remember you the other day?
Mm-hmm. He's not the same person that he once was. I don't know with his dementia what his mind is thinking throughout the day. We don't hear much of his voice anymore.
You comfortable, Dad?
Mm-hmm.
Okay.
So getting close to him kind of helps me feel like I'm having that connection with him. It's just hard to see life in him, and I'm trying to get something that maybe isn't there. I just can't imagine anyone taking better care of him than I am.
Dad, are you full or do you want more sandwich?
More sandwich.
Okay, good. Junior's got more sandwich for you, Dad. You give him a big old piece. Okay.
I think I've been doing this long enough. I know what to give.
I know, but it's like, wow.
2 weeks ago, maybe, my brother was here helping me with Dad, and my brother said, "Hey, Dad, do you know who I am?" And he said, "Yeah, my wife." And it just broke my heart. It scares me to be away from him for that long. Because we have such a routine, I'm afraid that he's going to forget me.
Remember I told you I'm going to be going to New York so I can see Jordan graduate?
Mm-hmm.
Okay, I'm going to be leaving in just a little bit for the airport, okay? Got it?
Mm-hmm.
Okay. You got the keys?
Dad and I have always just had this closeness. We had lots of just father-daughter conversations. And I miss just hearing Dad's voice. Just missing who he really was. Yeah. When I took the plane back from New York, I had a lot of mixed emotions. I thought, oh my gosh, the fun is over. But also, I needed to lay eyes on Dad. I needed that acknowledgement that he remembered me.
Did I tell you I had gone to New York and I was looking at Jordan and Pumpkin, spending some time with them? Yeah, Jordan graduated from high school. Yeah, and Pumpkin had her birthday this past weekend. I gave Jordan some graduation money from you, okay? I love you. Do you know who this is, Dad? Who am I? Oh. I love you so much. When he said my name, it sounded like Dad again. You know, like my old dad. Just kind of matter of fact. Okay. And that's all I needed. That's all I needed. Thank you. Thank you. As I was watching the clip, the only thing that kept going through my mind was I said my older sister's nickname on film twice. She's going to kill me. Okay. As a caregiver, I was not surprised to hear Rand's findings of mental health, like many. For so many in our communities, battles around mental wellness are a part of our daily life. Growing up, I always expected and assumed that one day I would eventually help my aging parents. However, because of my father's military service, that day came a little bit sooner than I had expected. In 2016, my dad reached a point where he was no longer able to live alone. He was living totally reliant upon a wheelchair and beginning to experience the early onset of Alzheimer's disease. I knew that someone needed to live with him full time, so I left a career and a life that I loved in Los Angeles to return to Kentucky. I never questioned the move because I was glad to be there for him, of course. But the sudden change in my social life, career aspects, and where I saw my future going was very difficult. Excuse me. Sorry. Immediately, I felt the emotional tax of caregiving. As I have always been a proponent of reaching out for help when needed, I recognized that I was going through a depression, and I reached out to get some help for myself at that time. Over time, I have found my footing, but like so many caregivers, I have experienced hard, unexpected downturns. For instance, in 2020, my father was hospitalized with COVID, and ever since, he has been bedbound, and his care has taken on a whole different level of difficulty and worry. Tending to my father's every need, including his personal hygiene, has forced us to confront and work through emotions and vulnerabilities that one cannot truly anticipate. The decrease and uncertainty of available respite care has greatly reduced the already limited time that I take for myself. Making sure that my father is clean and comfortable throughout the night has kept me from having a good night's sleep for the last 8 years. And while I have learned to function on inconsistent sleep and just a few hours a night, I do recognize just how much lack of sleep can make you irritable, sad, and physically exhausted. Perhaps one of the hardest parts of the journey is the constant feeling that something traumatic is about to happen. Because of my father's fragile health, I never stop worrying about his wound care and the consistent attention that it requires. Is the sniffle going to turn into pneumonia? Am I doing everything I can to keep him safe? I feel this way, especially living in Kentucky with consistent tornado warnings and sightings, and I cannot physically get him into the basement with me. So I barricade Dad into his bed with mountains of pillows and blankets and pray for the best. In some ways, I feel that nobody can take care of Dad better than we can at home. But that mindset has also tied me to an incredible amount of responsibility and a fear about what happens if I miss something, if I make a mistake, or God forbid, if something should happen to me. I am so grateful for everyone gathering here to ask what they can do to help. For overwhelmed caregivers, the options to help are limitless, from flexible work policies, as you've heard mentioned earlier, to respite services, to increased mental health care, and anything that can be done to streamline and simplify our lives is greatly appreciated. It will also support our mental wellness and give us a bit more peace of mind. So thank you for listening and for joining the Elizabeth Dole Foundation's mission. To add additional insights and perspective on the mental wellness experience of military and veteran caregivers, I am pleased to welcome our panel on prioritizing mental health, moderated by Dr. Roland Illing, Director of Global Healthcare and Chief Medical Officer for Amazon Web Services. To further add insights and perspective on the experiences of caregivers and veterans, the Foundation is also grateful to have current and past senior leaders from the Department of Veterans Affairs to discuss the state of caregiving today. We are pleased to welcome Dr. Sharif El-Nahal, the VA's Undersecretary for Health. Confirmed by the Senate in 2022, Dr. Elna Hall leads the largest integrated health system in the nation, alongside a team of nearly 400,000 professionals delivering care to 9 million enrolled veterans. Joining him on stage is Meg Cabet, who was recently named Chief of Staff to VA Secretary Dennis McDonough. Meg has worked with the greater veterans community for more than 25 years, including her leadership of the VA Caregivers program and her previous role as Principal Senior Advisory for Families and Caregivers and Survivors. Finally, we're proud to welcome the 8th Secretary of Veterans Affairs, Bob McDonald. He was selected to lead the VA in 2014, where he earned the nickname Secretary Bob. He previously served at Procter & Gamble for 33 years, the last 4 of which as Chairman, President, and CEO. In 2023, Secretary Bob was unanimously voted as chair of the Elizabeth Dole Foundation's Board of Directors. Everyone, please welcome our panel.
Please welcome to the stage moderator Dr. Roland Illing, caregiver Dr. Sandy Cullens, and esteemed panelists, the Honorable Chip Fulgham, Dr. Colleen Richardson, and Dr. Michael U. O'Hara.
Great. Lovely to see you all. Thank you very much for joining us at this panel, which is promoting military and caregiver well-being, prioritizing mental and emotional health. An incredibly important topic and one that has been touched on at numerous points already this afternoon, but I hope you'll bear with us for the next 25 minutes before the break. And I know it's been a long period of time since the break, so thank you for staying here now. It's a privilege to be here today to contribute to this incredible cause, and thank you for the organizers and the incredible leadership that has been shown and the resilience of all of those in the audience who've had a hand in this now. I'm delighted to host an incredible panel that have got really deep expertise about this subject, and I hope you'll agree they've got great insights to share. First, on my right, I'll go down the list very briefly. So Dr. Sandy Cullens is a caregiver fellow and clinical psychologist, and she's also a caregiver herself. Dr. Colleen Richardson is the executive director of the Caregiver Support Program at the Veterans Health Administration, and she too is a clinical psychologist and also a veteran. Dr. Michael O'Hara is the vice president and chief medical officer at Booz Allen Hamilton and has been working at the leading edge of technology innovation. And finally, Chip Fulgham, who's the CEO of Endeavors, which provides community-based housing services, veteran family mental health and wellness clinics, and much more. Chip is also a veteran and served as Deputy Undersecretary for Management at the DHS. My name is Dr. Roland Illing. I'm the Chief Medical Officer and Director for Global Healthcare and Nonprofits at AWS. That is AWS, not Amazon.com, so I'm on the technology side of the house, and AWS provides the technology infrastructure to deliver care at scale, and we're proud to support a lot of the large institutions across the US, including the government. So, to start, I think everyone can agree the RAND report that was discussed earlier, and those that went into those 9 areas that were highlighted in the RAND report, are incredibly interesting and show a lot of real insight into the current standings of caregivers across the US to military and veterans. I think it eloquently details why it's so important to support our caregivers, but I've got 2 very quick questions for each of the panelists just to set the scene. So first of all, what finding in the report was most interesting to you? And if you had to pin down what the most important reason to support mental health and emotional health of military and veterans caregivers was, what do you think it would be? I can go first, by the way. I just think it's incredible that there's a $100 million value in salary to all of the caregivers across the US, which basically goes unrecognized. And I think that an incredible value that's being provided to the economy through all of the caregivers, both in the audience and watching online. So starting off, what do you think?
To increase the mental health and substance use treatment for caregivers and their children, because caregivers are not immune to mental health disorders.
I think what was interesting to hear was about the religious component of the findings was being able to implement spiritual-based care for our caregivers as well as another piece of caregiving and recovery.
When I read the report, there was a couple of things that it's pretty easy to get, taken aback by some of the stark statistics. But the other part of it was that I took away from it, maybe that others didn't, was the tremendous impact that this is driving, right? I think it's easy to say that there's a lot of needs, but if you flip those statistics in reverse, that's the impact that these caregivers are having nationally to our veterans.
Yeah, I think the fact that 44% are experiencing some type of food insecurity is pretty incredible in a nation that's the wealthiest on earth. And the fact that so many are below the poverty line or at or below the poverty line is something that we need to address.
Great. I think they're all really important points. Looking specifically at the emotional well-being and mental health side, Dr. Collins, you're a clinical psychologist, and you treat people every day, but you're also a caregiver yourself to your husband. So you've obviously got a lived experience of both roles, which I think is quite a unique perspective. So how do you manage to manage your own emotional wellness as that of your patients? Because that's quite a duality you have to cope with.
Certainly. Thank you, Dr. Illing, for facilitating our panel today. I'd like to begin by expressing my deepest gratitude to Senator Elizabeth Dole and my friends at the Dole Foundation for this amazing opportunity. It is truly an honor to be here, and your unwavering love and support means the world to me. As a caregiver and a clinical psychologist, I have developed a unique understanding of the invisible wounds of war and a passion for supporting our service members, veterans with post-traumatic stress disorder. I'm married to a U.S. Marine who was wounded in action. I started my caregiving journey when my husband Doug was on active duty, and I've been his caregiver for 15 years. During my husband's military service, he completed 3 tours of duty to Iraq. While deployed to Iraq in 2003, Doug sustained a traumatic brain injury from an enemy rocket-propelled grenade that has required years of rehabilitation. He has also lost countless numbers of friends in combat and to suicide, and lives with a deep sense of survivor's guilt. When my husband returned home from combat, he was a different person and struggled with nightmares, vertigo, insomnia, headaches, flashbacks, agitation, anxiety, and depression. As a caregiver, I have faced many challenges. In 2008, my husband called me in the middle of the night during his 3rd deployment to Iraq to let me know that he was being medically evacuated to Dole Regional Medical Center in Germany. At this time, I was living on base in 29 Palms with our sons, who were 1 and 8 years old. Immediately, I felt devastated, overwhelmed, and hopeless. How was I going to help my husband? And how was I going to explain to our kids that their father had been injured? As children of a combat wounded veteran, our boys have had to grow up fast and have felt confused and worried about their father in ways that no children should ever have to. At times, our boys have felt alone because they did not have friends who understood what they were going through. In 2009, I became fully involved in my husband's care and drove approximately 3,000 miles in search of care for him and to all of his medical appointments. From 2010 to 2014, my husband's physical and psychological symptoms became severely debilitating. As a result, he was treated for the invisible wounds of war at various military hospitals, including Walter Reed National Military Medical Center, Bethesda Naval Hospital, Fort Belvoir Community Hospital, Balboa Naval Hospital, and the National Intrepid Center of Excellence. Despite his combat-related injuries, he was committed to staying in the military and receiving care while he continued to serve. In 2016, my husband was medically retired from the military. During the medical board, I was very worried about my husband because the process was very triggering, and it brought back so many painful memories of his traumatic experiences in combat. I am no different from any other caregiver. I do not have all the answers, I have often felt overwhelmed, isolated, and have experienced compassion fatigue. I was even afraid to ask for help when my husband was in the military because I was worried that he would lose his job if I did. Eventually, caregiving took a toll on me both emotionally and physically. During my husband's treatment and recovery from the invisible wounds of war, I became chronically stressed and extremely overwhelmed, and I had a miscarriage. This is something that I have never shared publicly. Since that experience, I've learned to take better care of myself through the love and support of my friends and family, and I now realize that taking care of others starts by taking care of myself. Caring for my husband is very personal and different from caring for my patients. I assist my husband in ways that I would never with my own patients. With Doug, I am his caregiver and first responder. I help coordinate and manage his care at the VA. Additionally, I help him cope with stress. I help him cope during stressful situations and help manage his triggers for PTSD. All of which I do to help mitigate my husband's risks of suicide. It is extremely meaningful and rewarding to be able to use what I've learned as a caregiver and military spouse to help others in my profession. As a psychologist, I carry a full caseload of patients, each with their own unique challenges. Any one of them can be overwhelming if I don't apply healthy clinical boundaries. But I also come home to my husband, who is suffering without treatment at this time, and I have no relief valve for myself. Even though I practice self-care, I still can feel very isolated and exhausted. It was not until I was selected as a Dole Care Fellow that I finally learned I was not alone. Becoming a Dole Fellow has given me a place where I can openly and comfortably share my experiences with a wonderful and compassionate group of friends. Most importantly, I've developed a great support network through the Elizabeth Dole Foundation, and together we are stronger. I'm so grateful to be here and to have the privilege of speaking on this panel. I'm not alone in this caregiving journey, and becoming a Dole Fellow has strengthened my resolve to continue to advocate for our military veterans and their caregivers. Thank you.
Good job. Thank you so much for sharing your story, and I know it took a lot to talk to the audience about that, so thank you for sharing. And also, thank you for being able to carry on caring for care providers despite also managing this yourself at home, because it's no mean feat to be able to do that at the same time. So again, thank you for sharing. Dr. Richardson, so the RAND report highlighted a higher prevalence of mental health diagnoses in caregivers of younger military, specifically those under 60. How does that match with your experience, again, in your clinical experience? And what does the VA Caregiver Support Program offer to the unique mental health challenges of this group?
Thank you. So, I mean, I've been a clinical psychologist now for about 18, almost 20 years now. And I don't think it comes as any surprise that mental health services is something that people need in general, right? Not just caregivers, but everybody. I mean, at some point in our lives, we will all experience some sort of depression, some sort of anxiety. But I think when you start adding what it is that caregivers do each day, on top of what we experience in everyday life, it definitely adds to, and we heard a lot about burden. So one of the things that we started in the Caregiver Support Program about 1.5 years ago was something called virtual psychotherapy for our caregivers. And you heard also through the RAND study about various options that should be available to our caregivers. We know that our caregivers, and especially our veterans, aren't always comfortable being left home by themselves, or they're not always comfortable having somebody else come into the home that they don't know to care for them while their caregiver can take the time that they need to get the services that they deserve. So we decided to put together a virtual psychotherapy program for our caregivers enrolled in the Program of Comprehensive Assistance for Family Caregivers. Today, we have that available in all 18 VISNs across the country. We've seen about 14,000 appointments for our caregivers. So that is just one of the many ways that we are looking at mental health resources for our caregivers. I think the other thing that we talk about is that non-traditional mental health care, right? Not everybody, and I'm a veteran, and I know some of the veterans in the room, we don't always want to sit down and talk about our feelings and talk about what's going on with us. And so you have a lot of non-traditional ways in which we can offer mental health too. So some of our local facilities will do non-traditional mental health therapies as well, whether it's through yoga, whether it's through various groups that they have. But the other thing that we've revamped this year, and I think is going to be phenomenal, is peer support mentoring. Because how many people want to be able to connect with other people that have been there, that have gone through that journey, who may be further along in that caregiving journey than they are. I know our veterans love peer support, and I think our caregivers would greatly benefit from that as well. It's more non-traditional, if you will, and it allows you to connect, because we heard that too, like Sandy had mentioned it, she feels part of something now as being an Elizabeth Dole Fellow, and I think our caregivers want to experience that too. So we have committed to getting one peer support mentoring at every VA medical facility across the country to support our caregivers through that journey as well. And I think we're at 270 sites as of right now, so we're halfway there, team.
That's fantastic. And that, I look forward to that being rolled out further. And again, I think that peer support is very interesting because, as you say, it's often when you meet someone who's got some simpatico, they understand what you've been through, it's easier to then open up and actually share that burden. So congratulations and thank you. Dr. O'Hara, so the RAND research also highlighted about issues around access to care. So caregivers weren't finding the care support they require through time constraints, cost, fear of hospitalization. What solutions are you coming across and implementing that can address some of these access challenges?
Well, I thought it was very interesting, you know, the quote that was shared earlier when you were going over the RAND report. You know, the one size doesn't fit all, but we all have similar needs, right? And so targeted solutions. But the biggest trouble when you think about it from an enterprise or, you know, a global problem is how do you target those solutions and how do you know what these pockets of needs are? You know, they may be different based on geography, based on socioeconomic status, based on other aspects. And so, you know, we talk a lot about data-driven insights and data-driven programs. And one of the things that I'm very excited about is to be able to provide some of that data to the Elizabeth Dole Foundation. As I think many of you have seen outside, some of the EpiMaps data, the ability to visualize where those pockets of need are and target solutions based on, based on publicly available data sources and so forth. And then the other aspect I think that you just spoke on, Colleen, which is the ability to think about those solutions that are not traditional healthcare. Too often a physician will get up here like myself and say you need traditional mental health care, you need a medication or a solution, and I think what we found is that that's not always true. Needs are diverse, they're complex, and there's a spectrum of needs. And so the ability to target social determinants of health, to the soft aspects of healthcare, often considered non-traditional healthcare, is something I'm really excited about because I think that closes a meaningful gap in these services. We saw that, just to talk about the diversity of this caregiver community and the diversity of problems that they face, there was such a dichotomy between those who were caring for caregivers under the age of 60 and over. Those are insights that now we have to think about what type of tailored solutions I can offer to each of those demographics. And I think we're all probably under the assumption that they're going to be different, right? And so the ability to know that know those insights, to abstract that, and then to apply non-traditional and traditional healthcare in tandem, those are things that make me very excited for the future.
That's great. I think we see that in many, many disciplines where if you can bring transparency to the question, the problem, that often answers will fall out of it. And if we can bring scale, and again, that's one of the parts that AWS is can bring, is that democratization of access to scale computing data and then insights. That's where interesting things happen. Again, as you saw outside, some of the very interesting demonstrations of really interesting data integration. Thank you. Chip, finally to you. It's interesting that the RAND research shows those connected to faith communities. I think it was mentioned as one of the interesting highlights about the impact of faith communities for care providers. It showed that those connected to faith communities had less caregiver burden than those who aren't part of faith communities. So Endeavors was founded by 5 San Antonio churches in 1969, which I found very interesting. So how has Endeavors grown to support the broader community, and what's your own experience as a veteran yourself of this?
Yeah, so I would start with Endeavors was founded in 1969 by 5 Presbyterian churches with a basic belief that we were put here to do 2 things. We were put here to love God, and we were put here to serve one another. And we've never lost that basic belief. And so as we looked to see what we could do to serve veterans and their families, we started with mental health. And clearly, there's a mental health need as evidenced in the RAND report. But we thought there was more you could do, that it's more than just a mental health issue, that in order to help folks get back to the quality of life that they deserve, it requires a holistic view to wellness. And so it's more than just mind and body. There's a spiritual aspect of it as well that our organization, I think, is uniquely suited to fill that role. There's a connectedness piece that folks have talked about where just getting folks together with shared experiences helps them get on a path towards wellness. The RAND study talks about the financial struggles that folks face. So there's a financial aspect to wellness. The environmental piece, which simply means if you're outside enjoying the outdoors, you're probably on a path towards wellness. And then there's the knowledge piece, which is what things like today do. Events like today help further the knowledge and research that's required. And when you bring all that together, like we have in San Antonio with our Veterans Wellness Center, I think it goes a long ways to helping folks get as far left of thoughts of suicide and things of that nature as possible.
Fascinating. I mean, how can we as a group leverage the support from faith-based institutions to benefit all caregivers?
Yeah, I think that in every community, we should search out those who are driven by faith, because they are driven by a passion to serve, regardless of what that faith is. All of them at their heart want to serve their fellow man. So I think we just need to seek that out and embrace it.
Very good. Just as if you could give one bit of advice, and we'll come back down from you, Chip. If you had a caregiver or veteran in front of you today, so someone in the audience now or someone watching at home, and they're on the fence about seeking mental health services, reaching out for support, what would your advice be to them now?
It's okay to take a knee. It's okay to say, I need help, because you'll come back stronger.
Yeah. Dr. Uhura.
I shared one of the anecdotes and stories from the Warrior Games down in Orlando about a few months back. And I got there and I was being walked around by somebody who's also here today. And she pointed to all the families and the wounded warriors who were there competing at the Warrior Games. And she told me something that stuck with me to this day. And she said, you see, Mike, nobody got here alone. Nobody got here alone. Nobody competed today alone. And why that's important is I think that, as a caregiver, clearly you're stressed. Clearly you're doing more than you need to be. There are resources out there that hopefully we can get you more of. But remember the tremendous impact that you're having, not just on your family member, not just on your veteran, but also on the broader community and the inspiration that you're providing.
Thank you. Colleen.
So I think there's a couple things. I think one, I think mental health in and of itself, the stigma has to go away first. It's a big stigma around mental health. I think everybody in this room could raise their hand at some point in their life. We all needed mental health assistance. So I think I would say one, it's okay not to be okay. It's just not okay to stay that way. And the other analogy, and you'll hear this tomorrow, is when oxygen masks deploy from the ceiling, put yours on first before helping someone else. And so I just want to encourage our caregivers to help yourself so that you can help your veteran. And I know that that is so much easier said than done. As a former caregiver myself, I so can understand and appreciate that. So just want to remind y'all to put your mask on first.
Great.
I would validate what they're feeling and what they're thinking and encourage them to get help. I know it's hard. I know it takes courage. I am here to support you. I've been through this myself. It helped me tremendously, and I know that it can help you as well.
Thank you. Well, I'd just like to thank the panel on all of our behalf for your expertise and your openness as well, and thank you very much for sharing. My takeaway points on the panel were really, first of all, you are not alone. I think that's the key, and that there's a shared experience here that mentorship can bring. There are scaling programs available to those that need it, and that people should try and take advantage of them. There is, the social determinants of health are really important, and there's the data now available that can really impact this problem. And finally, it's okay to ask for help. And that, there is a community here being led by the Elizabeth Dole Foundation, which can help everyone. And I really do like the oxygen mask analogy. I'm going to use that one in the future. So thank you everyone as well in the audience for coming and for your attention and engagement. I'm sure the panelists will be delighted to take any questions that you might have in the break to follow. But thanks again to all the panelists. Okay. Well done.
The wall on my way out. Thanks, everybody. Thank you to our esteemed panelists, and those were really great insights. We're going to give y'all a break, but we've got like a really super compelling and interesting panel coming. Secretary Bob and leaders from the VA. So we're going to give you 15 minutes, but then we're going to go out and wrangle y'all back in for that discussion. We're going to have some really wonderful insights on how the research is viewed within VA and what we can do to ensure that we're listening to our caregivers and the data. So 15 minutes, we'll see you back here around 3:15. Enjoy your break.
Go. Please take your seats. The program will restart in 2 minutes. Rich Bland?
Just 1 minute till show.
Oh, 1 minute? Please return to your seats. The show will resume in 1 minute.
Like most people, I didn't even think about caregiving until my father was diagnosed with cancer. My dad was somebody who I idolized. I used to dress up like him when I was a kid in kindergarten and get made fun of because I wanted to wear like a suit and a tie. And then to go from that to giving him a bath is quite a traumatic thing.
Everyone has a care story. Caring for our families is the most important and invisible work that we will ever do.
Do you think we look alike? Here you go.
Doesn't matter who you are, where you live, what you do, where you come from, you need care.
How you feeling this morning? You good?
And we have this invisible army who are essentially holding us all up as families and therefore holding the entire economy up.
Let me pat dry your face.
People are doing everything they can and more, and it's simply not sufficient because we need to have a recognition that care is a public good.
So my dad is actually a medically retired Navy SEAL, and now he's like helping me just get stronger.
I'm here caring for 2 sick people, which is definitely harder than anything I've ever done in my life.
There's just this simmering crisis. Everyone is burning out, whether it's the care worker or the family member. Everyone is under extreme duress.
I have reintroduced a credit for caring bill. It is for those that are caring for their loved ones.
We're trapped in a caregiving crisis, within an economic crisis, within a healthcare crisis. I want to change the paradigm.
Now we have a once-in-a-generation opportunity to support all of our families and our caregivers too.
It really is up to us. All of us can help raise the banner for caregivers. That's why I'm excited to partner with WIDA and produce this documentary. Together, with your help, we can make a difference.
Hi, everybody. My name is Rich Bland, and I have the honor and privilege to work for WETA and partner with the Dole Foundation. It's such a pleasure to be here. It's not every day I get to follow Bradley Cooper, which I really enjoy. I want to thank the Dole Foundation for being a partner on the Caregiving film. So that's what you just saw a clip over. And you saw Lynette earlier, which is a digital short, and she'll be in the film as well. So I want to tell you a little bit about the film, a little bit about how we're going to roll it out, and a little bit about how you might be able to help. So the film, Caregiving, it's coming out in June of 2025. It's going to be an amazing way to raise consciousness, to raise awareness about caregiving across America, and a little bit about WETA. So a little bit, you probably know PBS, the 330 PBS stations. WETA is the flagship here in Washington, D.C. But what you may not know about PBS is that they rely on local stations to produce and create content that they think is important. So fulfilling our public service mission is incredibly important to me and to my boss, Sharon Percy Rockefeller, who sends her best to Senator Dole. And what we're trying to do is not just produce and distribute that content, so you'll see the film in June, but that the impact around it will raise consciousness about this issue. It will even potentially, our theory of change is narrative change. So how do we raise the awareness on this issue? So that'll be June of 2025, and it'll be on 330 PBS stations, and that's where you come in. So there's an opportunity. We already have 30 partners and funders on this film, but we'd really love each and every one of you to think about how you might bring this into your home, or your organization, or your community. You already will have your PBS community. We have about 99% coverage of the United States. How can we elevate this issue? How can you partner on this film? And I think the opportunity is there for you. Please don't hesitate to contact me or our friends at the Dole Foundation. or wellbeings.org. That's probably the easiest way that you can engage on this film. I just want to close because there's one quote from the film and around this work that means a lot to me, and I know a lot of you have heard it, so you'll have to forgive me. But as a takeaway, and this is from Rosalind Carter, our former First Lady of the United States. There are always four kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. So I'd just like to leave you with that thought and help us elevate this issue by partnering on caregiving come June of 2025. Thank you.
Please welcome to the stage 8th Secretary of the Department of Veteran Affairs and Elizabeth Dole Foundation Chairman, the Honorable Bob McDonald.
Good afternoon. I'm really excited about introducing two of my dearest friends to you and having a discussion about the current state of the Department of Veterans Affairs. Before I do that, I just want to remind you, on March 4th of 1865, as the Civil War entered its final weeks, President Lincoln gave his second inaugural address. You know, if you go to the Lincoln Memorial, on one side you have the Gettysburg Address, on the other side you have the second inaugural address. That's how important that second inaugural address was. And that's what became the driving force for those who care for veterans, and eventually the VA's official model. You may remember what Lincoln said, and I quote, "With malice toward none, with charity for all, with firmness in the right, as God gives us to see the right, let us strive on to finish the work we're in, to bind up the nation's wounds, to care for him who shall have borne the battle, for his widow and for his orphan, to do all we may achieve and cherish a just and lasting peace among ourselves and with all nations." When President Lincoln signed into law the earliest version of the Department of Veterans Affairs as the Civil War ended, many of the soldiers who needed support were immigrants. They didn't have families in the United States. Therefore, at the time of its creation, the intent of the VA was not to care for the family, but for the government to be the family of those soldiers who had sacrificed so much, because they had no family in this country. Congress purchased a bankrupt resort. I had the privilege of celebrating the 150th anniversary of it in Togus, Maine. That resort was used to care for veterans on the East Coast. It opened a similar veterans home in Dayton, Ohio, the central U.S. place, and then eventually a facility in West Los Angeles, California, which today is near Beverly Hills. Now, there are hundreds more facilities today, but these three facilities were the beginning, and this idea of caring for immigrants who had no families was the beginning of the Department of Veterans Affairs. American veterans have changed since the Civil War. Now many of them are multi-generational military families. Thankfully, many are surviving the battlefield wounds, illnesses, and injuries that they may not have survived in the past. In fact, you're 10 times more likely to survive the battlefield today than before the current set of conflicts. And many come home from the conflict or deployment to be cared for by dedicated family members, friends, and neighbors in communities all across the country. Thanks to the hard work of the people in this room, legislation was passed to create VA's program of comprehensive assistance for family caregivers in 2010, and the program was launched in 2011. Now that program serves caregivers and their veterans across the country. When I came to the VA in 2014, I'm sorry to say that caregivers were not enough of a focus of our work, but we worked hard to increase that focus even when legislation was constraining. And we've got two panelists who will help us go through that journey and say what we need to do next. Obviously, a critical driver in building VA's caregiver support was a 2014 RAND study that we talked about this morning, commissioned by the Elizabeth Dole Foundation, conducted by Dr. Rajiv Ramchan, Terry Tanilian, who's now working in the White House for veterans, and their team. Since then, the Dole Foundation and many partners in this room have worked to elevate awareness of caregivers in communities across the country and develop initiatives to support their well-being. Last year, VA officially changed its motto to include caregivers and survivors. This symbolic but critically important move officially cements VA's commitment to veterans, caregivers, and survivors. Now we formally recognize that these families, too, have borne the battle. Today, we're at another critical point for increasing support and awareness for veteran caregivers to achieve the highest quality of life possible. Not only do we have a major piece of legislation under consideration in Congress named for Senator Elizabeth Dole, which includes significant provisions for expanding home health care and long-term care for veterans and caregivers, but we now have a second RAND report, which you've heard about today, that clearly outlines the greatest areas of opportunity for this community. Now let's get into it. Next, it's my honor to introduce the Department of Veterans Affairs Undersecretary for Health and my friend, Dr. Sharif El-Nahal. In his role, Sharif leads the largest integrated health system in the nation, alongside a team of more than 420,000 professionals delivering world-class care to more than 9 million enrolled veterans. Prior to his appointment, Dr. El-Nahal served as President and Chief Executive Officer of University Hospital in Newark, New Jersey. This is Dr. El-Nahal's second tour of duty at the Department of Veterans Affairs, having served as VA's Assistant Deputy Undersecretary for Quality, Safety, and Value from 2016 to 2018. It was my privilege to ask Sharif, as a White House Fellow, to come lead VA's innovation program from 2015 to 2016. During that time, he co-founded the VA Innovation Ecosystem, a program that continues to foster the spread of innovation and best practices to improve veteran care across the country. Please join me in welcoming my dear friend, Undersecretary for Health, Dr. Sharif El-Nahal. It's also my honor to introduce another dear friend. Meg Cabot is the Chief of Staff of the Department of Veterans Affairs. Prior to her current role, Meg served as the Principal Senior Advisor to the VA Secretary, and previously in various leadership roles with the VA's Caregiver Support Program. She was really the driving force in the VA. I have to give her all the credit to elevate the role of caregivers in the VA. She's a licensed clinical social worker with more than 25 years experience supporting America's service members, veterans, and their families. She comes from a family tradition of service. She's the proud daughter and granddaughter of veterans. Please join me in welcoming VA's Chief of Staff, Ms. Meg Cabot. Where did you get that? Meg obviously has a fan club present. That's great. Sharif, I'm sure you do too. I'm their fan club if none of you are. These are two great leaders who are dedicated to service to veterans and families, military community, caregivers. I just couldn't be more happy to be here with you both. I think to get started, Sharif, if you don't mind, do you mind if I call you by your first names?
No.
Okay, great. I thought so. Because we're friends.
You were also my boss, though.
I wasn't. Wait a minute. Let's be clear on this, Sharif. I worked for you.
Okay.
And boy, I worked hard to recruit him to stay at the VA after his White House fellowship was up. Tell me how you think about caregivers. I mean, you're running the largest healthcare system in the country, if not the world. I mean, let's be clear. How do you think of caregivers as that part of your caregiving, part of your care portfolio?
Well, thank you so much, Bob, and I want to thank the Elizabeth Dole Foundation for holding this event, but more importantly, for the daily work they do for caregivers across the country. Senator Dole, we would not be here without you and your incredible impact. And we also wouldn't be here without Meg's work in starting the program. But I also don't want to undercut how much influence and how much leadership you showed as secretary when this program really flourished. It was really an honor. I just remember sitting as a White House fellow, my White House fellow Mariah Sclears in the front row, inviting me to the table when I was somebody who didn't have really much experience at all in a large organization, and saying that you can have an impact, and I will never forget that. I will never forget how supportive you were of my career and of so many others in the last many years of leadership you've had. On caregivers, listen, I think it's a pretty simple concept for me. Caregivers are not distinct from the mission we have for veterans. They are such important sources of support, and they are the critical part of allowing a veteran to thrive. They're the pathway, they're the mechanism by which so many veterans will either do well or not do well. And so, starting with your leadership, Secretary Bob, and leading into the leadership of Secretary McDonough, we've simply come to the conclusion that families, caregivers, are that critical to meeting the needs of veterans, and so we really do not differentiate in as much as we possibly can when it comes to our mission. So for example, as Congress has given us more authority over the years to provide more services directly to caregivers, we've taken that opportunity. We offer not only respite care, but now more and more telemental health and mental health services to caregivers. You heard from Dr. Richardson in the last panel how important that is for caregivers. And more and more, all the assets of our system, when it comes to healthcare, when it comes to our programming, is made directly available to caregivers as among the most important ways to directly serve that veteran. So to me, there is really no distinction, no difference between service to the caregiver and service to the veteran.
That's incredible, and that's terrific. Meg, as you know, and you and I experienced together, this isn't always the way it was. No. And you have many of the scars on your back and to prove that. Can you tell us, because you have the most unique point of view on this journey, where did we start and how did we get here? And what do you think were some of the breakthroughs along the way?
So, first of all, thank you all for having me be here. I'm thrilled to be a part of this panel and to be here as part of the day-long events celebrating caregivers and figuring out new and different ways to support them. I think, I remember back in 2011 when we were about to kick off the program, there was a lot of political pressure, excuse me, mostly from the Hill and some of our veteran service organizations to get going and get moving. And this was really a brand new concept, this idea of supporting individuals who are supporting veterans. I mean, other organizations had started to talk about caregiving, but it was mostly for older, disabled individuals and not for the veteran population. So to do this, we had to figure out how to do it, the definitions, the eligibility, all of those kinds of things, which was very complicated and still is. But I think back then that was really the pressure to get moving and get going. And we stood up a call center. And when we stood up the caregiver support line, the idea was that we would have it open for maybe 6-8 months because this program would get up and get started and then it would just sort of, not fall off, but there'd be a group of people who were involved and it would continue and there wouldn't be as much interest and people would know where to go to get information. So, and I look back now that caregiver support line is still going strong, receiving hundreds of calls every day. And so clearly this is a need that really, although Congress had this great idea to create this program, had no idea how large of a need that there was. And I look back and I think it was about a year into the program that I first met Senator Dole, went down to the Watergate and had this unbelievable cookies and tea. And
she can be very persuasive.
She can be very persuasive, yes. And we talked a little bit about what we were doing. And I really think that had it not been for the Elizabeth Dole Foundation and really giving a voice and a face to family caregivers in all of their work that they've done with the fellows and the different programs, that the spotlight would have maybe moved on to the next big thing. And it didn't. It's really stayed focused, and certainly there are other things that are really important in the veteran space right now that people are spending a lot of time on. But families and caregivers and survivors are still a big piece of the work that we do. And I think that's kind of the difference. I think, it would have been just another one of VA's programs. And not that that's bad,
right.
But it actually continues to be one of the bigger programs, the programs that people are still talking about. How can we change it? How can we grow it? So I think that's sort of how I think about it and look back.
Those words resonate with me. You remember toward the end of our time together in 2016, we talked about how do we plant this human-centered design, focus on veterans like a weed, like your worst weed in the garden. So even if we change administrations or whatever, it can't be pulled out. In a way, Sharif, you and I have talked about culture change and in organization transformations. Do you think we're there yet in VHA, for example? Do you think Congress is there yet in terms of the culture change? Tom Tillis was here earlier. He seems to get it. But do you think we're there yet? I mean, what do we need to do?
I think we're closer than we ever have been, Bob, but that journey never ends. And I think when you talk about continuous improvement, and by the way, when you talk about the Veterans Experience Office, which you founded, and how that has evolved to this point where nearly every what we call schema of a veteran journey is now mapped out. We understand the consistent steps that a veteran has to go through. And yes, we also understand the steps that caregivers have to go to navigate our many different programs. That is the baseline, as you used to say, the front stage work that we have to do to make sure that we improve veteran trust and caregiver trust. And so the reason I say we're closer than ever is that the data is telling us that. 92% of veterans now tell us that they trust us for their care after they get an outpatient visit. That's an all-time high. For the 9th consecutive quarter in a row, the overall CMS patient experience star ratings, which is the same rubric for private sector hospitals and VA, shows that on average, we're beating the private sector and 79% of our hospitals scoring 4 or 5 stars. Wow. Yeah. So what I think we need to do is make sure that that excellence in programming for veterans starts to translate much more clearly and effectively in our service to caregivers. And that's not to say that our programming hasn't made progress. In fact, we do measure trust among our caregiver cohort. It has improved. But where we can definitely do better is eligibility for the program, which is why we're undertaking an effort to expand the aperture and bring more caregivers into the system. We still say no to far too many caregivers who apply. And we've just seen too many stories, Bob, of caregivers and veterans who ultimately had to be denied based on the way our regulations are currently set up, but intuitively, deserve all of our programming, not just some of it. And so,
is it a regulation or a law?
Exactly. So
regulation.
We have the authority. The Secretary has the authority to adjust the eligibility criteria under certain circumstances, and we're undertaking that effort right now with hopefully news in the coming weeks. This fall, we hope to be able to share.
That's great news. Yeah. Sharif was talking about 92% trust. You may recall the original score after the Phoenix scandal in the fall of 2014 was 47%. So we've come a long way, which is terrific. Meg, what do you think about the new RAND study? What did anything surprise you in that, or was it reaffirmation of things you already knew?
I think there was a lot of reaffirmation. I always knew that the number was much higher than anyone was saying, just because every time I go visit a hospital, there are wives pushing veterans in wheelchairs or walking next to them. There are, and you could just, I think we had just barely touched the surface of what the numbers could be. So although I'm not surprised, I'm thrilled that we've got a better definition that hopefully we can use more consistently in other work moving forward and other research moving forward. One of the things I am surprised about is the age 60 as being sort of the delineating age of differences. I'm thrilled that we've moved beyond the post 9/11, pre 9/11 group. I never felt very good about that language because it just seemed so, it seems somewhat arbitrary, because I think there are many different reasons why folks have differences in their care needs beyond the date that they started requiring that care. But I think 60 is an interesting age because it really covers a whole gamut of different eras of service, different kinds of service that individuals would be involved in. So I am interested in digging into that aspect a little bit more. And then the last thing I'll say that I think we really need to dig into is that there's a section in the study that talks a little bit about requiring or feeling, I don't remember the exact, it's around inclusivity and being welcomed in and receiving care with paperwork, assistance with paperwork and all of those kinds of things, and that folks using VA services experience that in a different way than they do outside of VA. So that's definitely a chapter that I want to dig into as well.
I'm sure. Have you have a chance to see the study? Do you have any reactions to it?
It was definitely, there were definitely new insights for me, for sure. We have to really do what we can to make sure that veterans have the respite they need and the ability to be there and bring their full selves to the vet. So that was a very, very clear indicator for me. And I think the demographic breakdowns were also helpful. RAND is great because they show you things that you can't see even when you're in the organization. Because they do reach out to the ultimate stakeholder, the customer, veterans, and the caregivers who serve them, and definitely a valuable study.
Right. Senator Tillis was here earlier, and he was talking about the PACT Act, and he said that he had voted against it, somewhat predicting that it would create the budget shortfall that we see today. And his fear was that that budget shortfall could cause the VA to have to cut back services, and he didn't know where that was going to go. Can you give us any insight that you may have, Sharif, on that?
Yeah, I have a lot of respect for Senator Tillis. I think he's shown a lot of great leadership, and he's been a great collaborator for veterans in North Carolina. That said, I vehemently disagree with that point.
Good.
The opportunity to enroll more veterans into VA healthcare is life-saving. Every year we release a annual suicide report. Every single veteran suicide in America is counted and reported by the VA transparently every year. More than 6,000 veterans die by suicide to this day every year. Every single one of those suicides is potentially preventable. That's how we see it. And so the goal is 0. And one of the most protective things, one of the most important things America can do to prevent or at least reduce the risk of a veteran dying by suicide is connecting them to VA benefits and healthcare. And the PACT Act allows us to open our doors and do that in more ways than ever before. And we have taken every opportunity to do that, starting with an unprecedented outreach campaign, thousands of events for 2 years in a row in communities where veterans are, across every demographic of veterans, women veterans, American and Indian Alaska Native, minority, rural veterans, and including veterans in North Carolina. And we've enrolled them at record numbers, and we will continue to do that. And we've accelerated eligibility for health care because of that fact and many other facts that show how beneficial VA healthcare is to veterans. And so our view was to place ultimately the least risk possible on the veteran, meaning welcoming as many of them into the system as possible. And we're breaking records on volume of care delivered, to, by the way, on track to deliver more than 130 million appointments this year, up in every single category, including caregiver support. We're about over 80,000 caregivers across the country now receiving one form of support or another. That's a worthy investment that, in my view, warrants the $12 billion in additional supplemental funding to serve even more veterans and reduce the scourge of veteran suicide.
It all makes sense to me. I mean, you can recall when we were working together, we said as we improve access and as trust goes up, more people are going to come. So if you've got 92% trust, of course, more people are going to come. That's great news. There's nothing wrong with that. That's great. Meg, could you talk for a little bit about youth caregiving, child caregiving? I think one of the shocking things to most of us in looking at the RAND study, and particularly to see some of the vignettes, is what the youth go through in a caregiving household. What can we do to help those youth?
It's a really important question, and the RAND study certainly validates that that's a really important population that we need to focus on. I think there are several different things that VA can do. I'll share a funny anecdote. Back in 2004, 2005, when I was first working with active duty service members at National Naval Medical Center, VA was standing up the polytrauma centers that many of you unfortunately had to experience. And I remember that there was discussion about having to purchase changing tables because VA didn't have changing tables in any of their restrooms to change a diaper. And suddenly there were kids, babies, coming into VAs, and that, this was, to me, a very concrete example of VA having to really think and shift about how it cared for veterans, because veterans now had young children, and how are we gonna manage that? Now that's a silly anecdote, but I remember vividly thinking, how is that possible?
It's a great anecdote. Yeah. And veterans would ask us, veteran families would ask us to have daycare,
right.
so that they could go to their appointments.
Yeah. So I think there are the daycare issue actually is something that we're working on. I think by 2026, we will have daycare available through a couple of different programs. This is some legislation that was passed a few years ago, in which veterans will be able to have daycare when they're going to an appointment, because part of what we want to do is make sure that whatever the barrier is to getting that life-saving care that Dr. Elnahal was just speaking about, we've managed to figure out how to adjust for that. So daycare is one issue, but that's not necessarily, I suppose it's supporting the kids in some ways, because they're having some fun activities instead of sitting in a waiting room. But I think one of the things that we just have to do from the VA perspective, because the reality is we are limited in who we can provide direct care to. But what we can do is we can make everybody much more aware and understanding and really thinking about kids and the impact that some of the injuries and illnesses faced by our veterans is having on the rest of the family. We can also make sure that our teams, our care coordinators, our social workers, our therapists are aware of services that are available in the community. I think, back in 1995, when I was an intern at the DC VA, we really stuck to our own programming. We never referred anybody out to any other services. And so one of the things I think VA can do, the biggest thing we can do, is make sure that our staff are really armed with resources about local community programs to support kids in the community, so that they can, really help direct that family, the veteran, to help their kids. So that's really what I hope we're moving towards. We've had some really great discussions about having family coordinators. We've looked at that and piloting and having social workers really focused in on sort of what are all the family resources available in a given community. And so, you know, those are the kinds of things that we're really hoping to move forward with.
Terrific.
Over the next few years.
Sharif, I want to give you an opportunity to talk about your vision for VHA and maybe caregiving as a part of that. What, you know, where would you like VHA to be 5 years from now, different than today, for example?
I think the more our healthcare system works collaboratively with stakeholders that care just as much about veterans as we do, the more successful we will be. That starts, of course, with the entire caregiver community, which underlies our efforts, for example, to expand eligibility, working with organizations like Elizabeth Dole and other organizations that are caregiver-focused and survivor-focused, and increasingly with community-based organizations on many other parts of our mission. I mentioned suicide prevention as our top clinical and public health priority. One of the more successful programs we've had are the Staff Sergeant Parker Gordon Fox suicide prevention grants, which go to coalitions of private sector, nonprofits, veteran service organizations who get together and come up with proposals to better reach out to veterans and strengthen that social blanket of support. We just announced an effort last week to connect to every single hospital in America that's using Epic and Cerner, the top two electronic health records.
That's huge.
And so every one of those health systems can turn on this functionality now and identify that a veteran is in front of them and give them information that we can push about PACT Act benefits, about caregiver benefits, about different ways that we are preventing suicide, including, by the way, a policy that we announced earlier this year that can pay for the care of any veteran in America in suicidal crisis, not just veterans enrolled in VA healthcare. That is one of the main connections that we're making to all veterans across the country. The more we do work to fulfill the mission to all vets, the more impactful we will be on the most important parts of our mission to them.
Absolutely. You know, I'm just so proud of you both and so proud of the VA organization for what's occurred. It reminds me, the warmth in my heart from being here with you reminds me of a story. I was in a VA hospital and I was talking to a veteran in the cafe, which is pretty typical, right? When we go there, we seek out veterans to talk to. And the talk went on and on. I kept looking at my watch thinking, I gotta let this veteran get on to their appointment. And so I said to the veteran, I said, I'm sorry, I've got to go. I've got to let you get on to your appointment. I don't want to make you late. He said, I don't have an appointment. I said, you have an appointment? He said, no, I just come here to meet with my friends. And that's what I'm here. I'm here meeting with my friends. Unfortunately, time's run out. I can't continue, but please give it up for Undersecretary Sharif Elnahal and for Chief of Staff Meg Cabot. And thank you so much for what you're doing. We're very proud of you. Thank you. Great to be with you.
A special thanks to our presenting sponsor, TriWest Healthcare Alliance. Our host sponsor, Amazon Web Services. And our partners on the 2024 RAND study, Wounded Warrior Project, Lockheed Martin, AARP, and the Lilly Endowment. We now welcome to the stage moderator Dr. Shantanu Agrawal, caregiver Brian Vines, and esteemed panelists Liz Porter, Monica Rosser, and Dr. David Williamson.
All right, thank you very much for that, we are excited to be here. This panel is called Advancing Whole Health and Inclusive Care, Improving Outcomes for Veterans and Caregivers. I'm Dr. Shantanu Agarwal. I'm an emergency medicine physician and the Chief Health Officer for Elevance Health. We're a health benefits company caring for over 45 million Americans. Let me introduce the panel. So to my right is Brian Vines. Brian is an Army veteran and caregiver for his veteran wife, Natalie. Natalie was injured in Iraq in 2005 and 2009. She medically retired from the Army in January 2013 after 20 years of distinguished service. Brian retired from the Army in October 2012 after 28 distinguished years of service. Thank you. To his right is Liz Porter, President of the Health and Civil Sector for Leidos. Then is Monica Rosser, Executive Managing Director, Federal Health for Maximus. And finally, Dr. David Williamson, Neuropsychiatry Chief and Brain Injury Medicine Medical Director for the Walter Reed National Military Medical Center. All right, that was a long title. Welcome to the panel, and I'm going to take us actually back to sort of the beginning of the day and just ask each of you to talk a little bit about the RAND report, what stood out for you, but put it in this context since we're talking about whole health, what whole health means for you and why it's so relevant for veterans and caregivers. Let me start with you, Brian.
Well, thank you very much, and I appreciate this opportunity to be up here and speaking on behalf of my caregiver fellows, and I'm honored to share the stage with leaders in all your respective fields. Probably the finding that most resonated with me and a lot of my caregiver peers is number 6, and I'll paraphrase it a little bit, that to encourage healthcare systems to integrate caregivers into the caregiving teams. And I think a quote that I'm going to give you, I learned yesterday during our Amazon AWS training that came from Crystal, that said, a veteran's health is only as good as his healthcare team. And to me, that was just a blinding flash of the obvious. From RAND 1, I think we've got almost universal recognition that caregivers are now part of that caregiver team. But as we go into RAND number 2, I think being informed by that, we've got to take it to the next step, and that is that caregivers matter, and that caregivers add value to the caregiver team. Oftentimes, the sole person that has the best understanding or visualization of the veteran's issues, his aches or her aches, pains, limitations, is the caregiver. And who better to honestly speak to the caregiver team about that is the caregiver.
So pulling on Brian's thread there, I think one of the statistics that stood out to me, but was very relevant, is the fact that the caregiver isn't necessarily, especially for under 60, the spouse, and that it is this other category. And so when I think about the care team and the topic of this panel about the in-home ecosystem and thinking about whole health and how do you service, whether it's the veteran or the caregiver, holistically, so that you're not just taking about care of their physical health, but if there's food, that they have access to the different things that they need to be able to stay in the home. And so several of you know that my sister, who was not a veteran of the military, but was a veteran of the FBI, it was really the community, and I love Lynette, it was in Kentucky, in Murray, Kentucky, the community of not just my sister, my brother-in-law, and my nephews who supported her, but the entire town that would come and deliver food or that would come and help take her to her medical appointments. And they were the ones that were able to advocate for her and to say what it was that she needed to ensure that she was able to advocate for herself. So thinking about that holistically and knowing that that is a statistic that she's not alone in that journey was really eye-opening.
I've had the honor and privilege to be a caregiver to my Vietnam veteran father for the last few years. And it was the 40% of caregivers who have minor children. I'm a mother of 2 toddlers, so understanding that whole health of the mental, the spiritual, the social, the time restraints. So we talk about putting the oxygen mask on first, and you think to yourself, it's not a life and death scenario, but sometimes it is. So it was that aspect of dealing on kind of burning both ends of the candle, raising minor children, and then being a caregiver in this sandwich generation.
I want to thank the Dole Foundation for asking me to participate in this discussion. And I have to say, I feel very humbled as a physician because the report is consumer feedback to the medical profession that we are not doing a good job collectively communicating with the people that we most need to invest time and effort to communicate with. I maybe live in a bubble because I select out colleagues that I know are invested in staying with patients and communicating with family, but clearly that's not a ubiquitous phenomenon. And to hear that 2/3 of families and caregivers don't feel like they were included in treatment planning and aren't part of the care team is shocking. And it motivates me to go back and talk with trainees and educators about spreading the word. And I think that the report will catalyze that. As far as whole health is concerned, it's an ivory tower phenomenon that doctors practice in an environment that's very sterile and abstracted from the real world. And it is important to envisage and understand what patients are doing in the real world during the 167 hours in the week when they're not in your office, and who they're doing those things with, and what the quality of life and engagement is. And I commend the report for getting people to think about talking to the people that are part of that life engagement, who can talk about the quality of it and also where the challenges are. Because if you practice medicine in an office in that sterile environment, you can't really hope to make a change in a patient's quality of life when they're spending the majority of that out of your vision. So I think it's a wonderful opportunity to shake up the medical profession and get people thinking about real life engagement.
Thank you. I'll say from my standpoint that it was really surprising, almost shocking, to see the rate of poverty and social needs show up in this report among caregivers. I think we all know from a whole health standpoint, mental health issues and needs really stand with social health needs. And so to see that much and then the preponderance of mental health issues was, I suppose, expected, but very, very shocking. Brian, you made the great point about the importance of the care team. So I want to talk to our specialists here on the stage around that. So Dr. Williamson, you innovated a care model around traumatic brain injury. Can you talk about how your model is more inclusive of not just the patient, but their caregiver, but then also what a difference that can make in the outcomes?
There are a lot of different healthcare specialists who work with brain injury, and some of them work very early on in the brain injury journey with patients who are unconscious, and they're doing wonderfully advanced, technologically sophisticated things with neurosurgery and intensive care medicine and resuscitation, and also extending into the world of rehabilitation, all of which is hospital-based intervention for patients. Ultimately, though, patients leave the ivory tower and they go back to the community. And then there's a lifetime of a journey where people return to relationships, return to employment sometimes, return to being a parent, to being a spouse, to being a friend, to being a citizen. And that's invisible to the hospital doctors who don't follow them into that community journey. And what I've strived to do with the program that we have at Walter Reed is get input and data from people who are with patients in the community and understand what it looks like when the person with the injury is back in the home environment, and what are their limitations, where are their strengths, where do they need assistance, and what does it mean to be on all that medication and have symptoms of pain and headache and have communication issues and temperament issues translated into real life. Bringing real life into medicine is a hard thing to do. And what we've done to try and foster that at Walter Reed is create a space which is a little bit more like your home. We have in our unit, we have an area which is kind of like a living room, dining room, kitchen with the internet and the television and musical instruments, and it's social space, and we look at human-human interaction. That needs to be an important part of brain injury assessment, and trauma recovery is looking at human-to-human interaction. It's not something for the acute trauma and rehabilitation phase, but it matters very much in terms of long-term outcomes. So we try and study that, and we use a team of specialists from all the disciplines at Walter Reed to piece together a customized program for every patient. Every patient has a different brain, every patient had a different brain injury, and it needs to be a tailored approach based on the characteristics of that person, their support system, their caregiver team. And so we bring caregivers into the unit. They stay in the Fisher House, they come and listen to us when we talk to patients, they participate in treatment planning, and they also watch therapists do what they do with patients. So they get hands-on tuition, they're steeped in all the knowledge and wisdom that the different specialists and therapists have and can absorb that.
That's fantastic. I think we also saw during the pandemic, one of the first real issues was we removed the caregiver and the family member from the room. Obviously for good reason at the time, but I'm glad you are doing everything possible to not just bring them back in, but to integrate them in the therapy. Monica, so in what ways, again, I want to come back to this concept of whole health. In what ways can whole health improve the coordination of care and resources for caregivers and veterans to ensure that everyone's needs are truly met?
I want to foot stomp something that Dr. Williamson said. When you have that comprehensive care team that is looking at really a multifaceted problem, and when there is that coordination, you have that personalized care plan for better outcomes. You're empowering the veterans and caregivers to really make that family the center of the treatment plan and be assertive and focus on preventive care. Where can we kind of stop the problem before it starts? Where are we seeing things go awry? And that whole aspect of bringing in the multifaceted avenue of a solution set, I think that that's really where we're talking about better outcomes for care.
That's great. Liz, just to bring you into this again, how can the private and public sectors really come together to ensure that there's a unified caregiver support ecosystem that delivers consistent and high-value care?
So great question, tying in a little bit of both what Dr. Williamson said and what Monica said. If I think about the care delivery that you're talking about, Dr. Williamson, that's fantastic, especially if they stay within the VA or the military treatment facility, but how do you ensure that continuum and when they move out into the community? And so there's probably three ways that come to mind when I think about public and private partnering on these aspects. One, we heard a little bit earlier about policy. So policy tied to helping to advocate for policy, such as adding CPT codes that allow the time for caregivers. And as a public company, we have the ability to help to go advocate and amplify that message on the Hill, whether it's that message or it's passing other legislation that can be in support of the caregivers and being part of that care continuum. The other one is technology. And so on the technology side, as we think about technology that we want to implement, and when we're doing it for care in the community to ensure that it is seamlessly integrated and working well with care that is delivered within the military treatment facilities or within the VAMCs or the VA medical centers. And then the third area is data. Data is everywhere now, and we heard a little bit about data earlier for looking at kind of where the pockets of individuals are, but when I think about care being delivered, and if you think about even sometimes a cancer patient, the information around that care for delivery for a cancer patient that's happening within a military treatment facility, when it then traverses into the community, how do you ensure that the caregiver and the veteran don't have to repeat whatever it is that was done, that information is available, that they have that access? It's not just a technology thing, it's a data thing. So ensuring that we partner in those ways to make sure that those solutions are shared across to enable a better care delivery and ensure that the ecosystem is part of that solution.
That's great. I want to come back to data and technology in a second, but Brian, as a caregiver, I wonder how you reflect on each of these answers when you think about better coordination with the healthcare system, between healthcare and the community. How does that strike you as a caregiver? And is that different from what you experienced as a caregiver and then your wife as patient?
Sure. So let me begin by kind of addressing this, that I'm going to speak from me as a caregiver and talk about the whole healthcare system. And I'll start with kind of a definition and what that means to me. and then use my story as an example to talk about some of the pitfalls and speed bumps that my wife and I have encountered along the way to get to where we are now. The way I would define the whole health care system is really through the model. If you put yourself in the middle of a circle, you put yourself or me. And then informing, or actually you informing outside your little circle, is the professional help and the self-help that you receive. And it's not just about receiving that and being in a receiver mode, but it's informing, it's being in a proactive mode and taking charge of your own health care and your own self-care. And then around that, in a much larger circle, is the community. And that's all those touch points that we're talking about and many of the things that the panelists have already brought up here on the stage. And we look at that healthcare model as caregivers. It's not just our model. I mean, our model is important, and we've got to take care of ourselves, and we've got to get our own mental and physical health taken care of, and we've got to touch our community and our peer group of other caregivers. But we're also managing the health care, the whole health of our veteran. And if you have children in the house, and if you have elderly in the house, you're also managing their whole health system. So it can become quite overwhelming, even sometimes quite taxing. But going back to me and putting me in the center of the circle, that is something very difficult for a caregiver to do, because we are spending our life through selfless service, putting the needs of someone else before our own. So you feel almost shameful that you would ever put yourself in the center of that circle, but it is so important, and I can't emphasize it enough. And then seeking that professional care for yourself, your own physical health, your own mental health, being proactive and driving that, not just letting it drive you. Self-help is something that we talk about quite a bit amongst caregivers, and we always talk about the need, the importance of respite. We talk about caregiver fatigue or compassion fatigue, and it's a real thing. But a lot of times we feel shame in taking that time out for ourselves, because time is a commodity, and we want to spend that time giving our veterans the very best possible care that we can give them. So let me talk a little bit about my journey with Nally. As mentioned before, Nally suffered a traumatic brain injury. She has a seizure disorder, severe migraines, cognitive issues, and severe PTSD, just to name a few. So when we got out of the military back in 2012, both of us, we went from being a part of an organization that was very rank structured, very self-efficient, one day, to the next day, nothing. We weren't plugged into anything, and we had to start a whole new process. Now, since that time, our military, our Department of Defense have gotten better, and the VA has gotten better in helping with a more softer landing for veterans leaving the service. So the first thing we reached out to, besides our own physical needs for health and mental health, was to try to find that community. And what we found is we plugged into all the wrong communities. We plugged into toxic family members. We plugged into veterans groups that were dealing with their own issues through substance abuse, through alcohol abuse, and you can just see all the negativity that came out of that group and how it affected Nally and I's relationship. And our bedrock that got us through all this was our faith. And we talked spirituality in the previous boards. We talked spirituality and how important, at least in mine and Nally's life, is having strong faith to get us through that. So the way we kind of got through that and got to a better place is we went out and sought a more healthier community. And that community evolved into a gym. And so we met with like-minded people with like-minded goals of fitness. And everyone's an athlete. It's just how you approach it and what you can do. Either it may be breathing or it may be, extreme CrossFit, whatever is best for you. But it's us coming together with a community with like-minded goals that were into nutrition, that were into health. It brought Nally and I together. And that was aided by other organizations like Wounded Warrior Project that provided retreats to help us with communication within the marriage, retreats to help us deal with our own combat trauma, and retreats just to give us respite and to recognize us as caregivers. So that community is so important in finding not just a community, but finding a healthy community. So that is something that I would like to just impart upon y'all from my story about the importance of community and how it's led us to Nally been married for 25 years now, and we're happier now than when we first got married because of all that.
That is. That is fantastic. Thank you for sharing that. The importance of community. Let me come back to you with one question. I've been struck throughout the day about some of the negative emotions that caregivers feel. You talked about shame and guilt, concern about putting yourself at the center of this model. Can you just say more about that? I just want to understand it more, because from an outsider's perspective, it's one of the most noble roles, right? It's a role of service. So it surprises me to hear about the negative emotions. Could you just talk a little bit more about that?
Well, I think that I've got to give props to Senator Dole and the Dole Foundation for myself as a caregiver and the other fellows in here, is giving us a voice, empowered us, and resourced us. And it is going into being a caregiver with that confidence that has helped just immeasurably. I can't even explain that. But it's through that and through that lens that we develop and we grow as caregivers. And it's being a part of a caregiver community with similar goals that we can share best business practices that I think that helps us grow as a community and makes us more effective caregivers.
That's great. That's great. Again, that theme of community being so important. I'm almost tempted to join your gym. I would be on the breathing side of the spectrum. Yeah. So let me open it up to the whole panel. I do want to come back to technology. We talk a lot about technology in healthcare today, digital technology, AI. Is there a role for technology in caregiver support, and what do you think it should be? Anyone that wants to start?
Go ahead.
I'll start. Right now, it's too much of a pull for resources. So I'll use an example. You're searching. You've gotten the worst news of your life, right? Your father's terminal. You're trying to find that next step of where do I go? What do I do? You think you can navigate the space. In my mind, and I know some of my colleagues in the room, a caregiver hub. Something where it's a proactive exchange of information, where we're pushing those resources out to folks, where it's a centralized database and saying, here's all the trusted resources, is a one-stop shop. And you can go through those things. And EDF and all of the work that the Elizabeth Dole Foundation has done has been a paramount stepping stone for that. But I see that that's where no more searching. We got to go to one central place.
That's great.
Yeah. So I would add to that. I mean, I definitely think there's a place for technology. I think the key, and you heard it in the study, it has to be tailorable, right? So the user-centered design, thinking about as a caregiver, there is not enough time. There's not enough time to think about all of the things. So how do you make it as easy as possible? And we heard about how many of the caregivers and the veterans are in rural locations. How do you make sure that it's accessible even if they're rural, right? So there is absolutely a need and a place for it, so that finding what you need is much easier, and or helping to create that continuum of care is much more seamless. And so that I even think about going through it right now. It's like, if I don't have access to my sister's medical records, how do I know how to help her, right? And so I get, that's PHI, maybe I shouldn't have access to it, I don't know, she wants me to have access to it, can I find the paperwork that says I'm allowed to have, because I'm allowed to be have her directives and things, but it's like, how do you find those things at that moment? And it's almost impossible. So how do we make all of that easier? And technology can do it, but technology has to meet the user where they're at, as far as the level of maturity they are. So I do think there's a place for it. I think it's figuring out that right way to make it tailorable.
I would add how technology could help us is just through having a standardized communication amongst all the VAs and all the subsets of the VAs. A lot of times there are barriers to success to communicating with your primary care manager, between your specialty care doctors communicating with each other, one VA being able to communicate with another VA. But having a standardized communication tool, much like In Texas, we have Baylor Scott White, that all the doctors can see all the notes from all the other doctors, and they're one team, and it's a team approach to taking care of the veteran that's using that type of health care.
I have two specific suggestions for caregivers with respect to technology. One is that hospital systems and administrators are increasingly sensitive to social media and customer satisfaction surveys. So use that feedback mechanism to say, I wasn't included, nobody talked to me, I felt confused about the lack of information, because somewhere in the hospital infrastructure is somebody who's going to digest that information, feed it back to leadership, and it will have an impact. So it is important to make noise about the deficits in how the practitioners work. The other thing is, I was struck when I was listening to Meg Cabot talk. Meg was working at Walter Reed when I first went there, and I remember the introduction of video technology to communicate with other providers, and it would take us half an hour to get the camera to work, and we'd almost be out of meeting time before we had the VA on the other end of the phone in Richmond, and the video phone in Richmond. But now, if COVID has done one constructive thing, it's made it routine for people to use Zoom and Teams and other platforms. And that's a medium where caregivers can routinely communicate with providers. But not only that, give us a window into what home environment looks like, what the community setting looks like. And there's no reason why we can't increasingly use technology like that to bring home life into the clinical discussion and not have the hospital be the frame of reference, which is so sort of sterile and abstract from the real world. So I think pressing for that, it's perfectly legitimate, I think, as a caregiver to say, hey, I can be there for your next team meeting, I'll just do it virtually. Can we get a Zoom link or a Teams link to do that? So ask for that.
I love as a theme in a couple of your comments you've talked about the line between hospital and home and blurring that more. And I think that is just so important for this population, but frankly, every population. All right, so we have very little time left. We've got maybe 40 seconds. So I'm going to ask you the magic wand question, which just go down the line. One thing you can change that would improve the whole health of veterans and their caregivers. Quickly.
I would like legislators to license physicians to virtually practice in all 50 states. So I don't. Nice. So, yeah.
I think the further recognition of not everything is an ADL, and that there is a whole sphere of caregiving. Yeah.
So I would have said lift the stigma, but it's not a stigma. I would lift the feeling of guilt and ensure that every caregiver reaches out for the care that they need.
So if I had a big magic wand, I would fill all the staffing shortfalls within the VA. That is driving longer wait times for appointments. It's driving longer wait times to even get an appointment. And it can often be a source of frustration when you call into the VA and you can't speak to someone because they're out or they haven't filled that position.
That's awesome. Well, I can't top any of that. Please, just let's give the panel a final applause and for the day. Thank you. I think we go.
Please join us after the program for a reception honoring all military and veteran caregivers and their families. Please welcome to the stage caregiver Teresa Coomer and Director of Veteran Services at CGI Federal, Nathan Naylor.
Well, hey, everybody. As you all likely know, or I hope you know, that Senator Tammy Duckworth is an American treasure. She is an Iraq war veteran and among the first women to fly combat missions for the Army during Operation Iraqi Freedom. In 2004, Tammy was deployed to Iraq as a Black Hawk helicopter pilot when her aircraft was hit by a rocket-propelled grenade. And that day, Tammy lost both of her legs and partial use of her right arm. For her actions, she has received the Purple Heart. And since then, she's led the way in creating a meaningful support for her fellow soldiers in the state of Illinois, in the U.S. Department of Veterans Affairs, the U.S. House of Representatives, and now as a senator in the U.S. Senate. And I'm pretty sure you also know that Tammy Duckworth is one of the most effective elected leaders of our generation. She's compassionate, kind, fierce, and whip smart. Working alongside Tammy Duckworth at the U.S. Department of Veterans Affairs is one of the greatest honors of my life.
As a native of Illinois and a caregiver to my husband, Marcus, an Army veteran who also sustained injuries and received a Purple Heart during his service in Iraq, it means so much, and I am so grateful that Senator Duckworth, someone who truly understands our journey, represents us in Congress. In a few moments, Senator Duckworth will be interviewed by Anna Palmer. Anna is the founder and CEO of Punch Bowl News, and she has covered Congress and lobbying industry, presidential campaigns, the politics of governing for more than 15 years. Anna co-authored the New York Times best-selling book, The Hill to Die On, The Battle for Congress and the Future of Trump's America. She also created a widely acclaimed daily podcast and a newsletter and event series at Politico. Anna, alongside her husband, EDF board member Patrick Melody, serves on EDF's national cabinet.
Hi, everyone. Hi, everybody.
What a warm welcome.
I mean, amazing. I'll slip you that 50 later, Nathan.
Well, Senator Duckworth, thank you so much for joining me on such a special occasion. I can think of no one better to have this conversation with right after the RAND study came out about veteran caregivers, about some of the really stark numbers that are coming out that I think put a fine point on the work that the Elizabeth Dole Foundation and so many of the other advocates who are here, the caregivers themselves, are doing. I want to start because we've got a lot to get to.
We do. They sent me like a whole thing of questions.
She's like, I got this. I don't need that.
We're going to do it.
I want to talk, though, about a subject you're really familiar with. Over the last decade, you've supported the Hidden Heroes, but as the research suggests, there's a lot more to be done. This is also personal for you. Can you talk about why it is important to have the support of the military and veteran caregivers?
Well, because without them, we could not take care of our wounded warriors and our heroes. I mean, it starts from the minute they show up at the military treatment center. It's the caregivers who are supplementing the clinicians, the doctors, the nurses. When I showed up at Walter Reed and I was kept sedated for 11 days, this was my husband next to me who was keeping an eye so that the charge nurse and the nurses who were handling all of these polytrauma patients could continue to do that. And then for all the time when I was inpatient, you know, it was my husband who was helping to change my IVs, the drip IV that I was on, who was cleaning my bedpan, who was doing all of these things. And I had both my husband and my mom there, and they took turns taking care of me, even though I was at the premier military treatment facility in the world, getting the best health care in the world. It still was really important to have my caregiver there, my caregivers, because I had both my husband and my mother there. And so watching all the other patients recovering as well, and seeing a lot of spouses, some parents, and especially the spouses trying to take care of the wounded service member, but also their children at the same time. And so we couldn't extend the level of care that we need to extend were it not for caregivers.
Yeah, I mean, I think that's one of the things that I've really learned in getting involved at the Elizabeth Dole Foundation is the whole ecosystem, right? It's not just kind of at the moment in the hospital, but it's that after. It's the years and years after. Talk about that, kind of the support that is needed from even your own experience that you've had.
Well, let me just say that the caregiver saves the government money. Caregivers save taxpayers dollars. If you were to pay caregivers the going rate that you would pay for a registered nurse to do what the caregivers do, it would cost billions of dollars to do that. And so caregivers really are a bargain for the taxpayers. And the least we can do is to provide them with, what is pretty minimum support so that they can extend the caregiving, and it's going to be the best caregiving that can be provided because it's a loved one providing for a loved one. But they need the respite care, they need the support for childcare, they need all of the help that they can get, and they are the ones who are. They provide the environment around which the clinicians drop in and out to provide the care, the ongoing health care that person needs.
Well, I want to talk about the economic impact. The RAND research had some pretty stark statistics. I'm going to read them because I don't want to kind of go on the fly here. They found that more than 1/3 of military and veteran caregivers live at or below the federal poverty level. That's the line that SNAP and WIC benefits kick in. When you consider that the average out-of-pocket expenses due to caregivers for these folks is about $8,500 a year, and the impact of caregiving duties on employment, these are dire financial numbers we're talking about. Can you talk about what you see as the greatest opportunities to help solve some of those financial challenges? Is it Congress stepping in? Is there, a presidential, kind of the VA? What can we do to help?
Well, there's several things. I mean, for those who are on active duty, I was able to create the Basic Needs Allowance program, which provides support, nutrition support for those who are at the 120% below poverty level. The next year we were able to raise that to 150% poverty level. But we need to also look at how we figure SNAP benefits as well. Right now, your SNAP benefit for military families, it's the only part of federal government that counts BAH as income. BAH is not counted as income anywhere else, not for when you pay the IRS, for your taxes, not for anything else, but when it comes to SNAP, it counts as income, and it leaves a lot of people ineligible because they're seen as having too high an income. So that's one quick thing that we can do. I try to get it, I've been working on it, keep working on it. If we can get a farm bill, the next farm bill, I'm going to try to get it into the farm bill as well. But that's one thing that we can do. One of the other things we can do is under the VA system, increase support for caregivers. We have some respite care, we have some basic payments, but I don't think it's enough, and we certainly should be pegging it to inflation.
Yeah, when you think about that, right, we're going to have a continuing resolution, so the government's going to get funded by sometime this week. But there's going to be a big package, an omnibus at the end of the year, the National Defense Authorization Act. Are there things there? The Farm Bill is one of them that potentially could get done. I'm a little more skeptical about that personally. But when you think about some of the policies, that's the authorizing factor, right, is really kind of setting the agenda when it comes to defense.
Yeah, I think this needs to be, caregiving needs to be part of anything that we move forward on when it comes to either defense or VA. I mean, I think, for example, the PACT Act was amazing, very bipartisan. We got that done, but there should have been a bigger, more robust part for caregivers within PACT Act. PACT Act was just about eligibility to access VA and get care, but we haven't plussed up the caregiver side of things as well.
All right, I want to talk about mental health. It's something that we talk a lot about at the Elizabeth Dole Foundation. And there was some glaring finding in RAND's research. Caregivers to veterans under 60-year-old have disproportionately high mental health needs, but they aren't getting the care that they need. There's a variety of reasons. Maybe it's access, sometimes it's cost, fear of hospitalization, fear of retribution. What do you think can be done when it comes to the role communities can play, the role that Congress can play in terms of making sure that people have that mental health care access they need as caregivers?
Well, I think the RAND report said that only 1/3 of 9/11 post 9/11 caregivers had spoken to or seen a mental health professional. I think access is a big part of it. I think there's a shortage. There's a shortage of certified licensed counselors across the nation, and we need to work on that workforce piece. But we also need to get more of that workforce into the VA system and have use more of the telemedicine. A lot of that work is people, if you're caregiving, it's really hard to go into an appointment. So being able to have more telemedicine for caregivers, for mental health counseling is really important in supporting that. But a lot of the access issue is really a workforce issue. I think from the earlier panel, I heard the magic wand, fill every opening at VA. I would second and triple that. And that really is really important for caregivers in particular. For mental health.
Another area that we focus on a lot is the children. We were talking about it earlier who are impacted. RAND found that 40% of military and veteran caregivers are also raising children. These children are often performing caregiving duties themselves. For veterans, like administering medicine, they often learn to avoid triggering behaviors at an early age. Can you share how your children have been part of your injury and recovery journey and what you've seen kind of in the community more broadly?
Yeah, so I had my children 10 years after I was wounded, so it's a little bit different experience, but I certainly saw during the recovery process how often the children, especially slightly older children, were very much involved in that rehabilitation process. They're in the occupational therapy, in the physical therapy room with you, and then they're the ones dealing with having to mature much faster than they need to because the caregivers focus on, especially if you have severe disabilities, for the caregivers providing caregiving, so the children have to learn to be more independent, and they, as you said, administer medication, all of that. We need to support the children as well. We need to provide mental health counseling for the children as well, because we now know that spouses and children and dependents also suffer from post-traumatic stress, as well as the veteran themselves suffer from post-traumatic stress, and so we need to expand that support. My own children, even though I had them 10 years, my firstborn 10 years after I was wounded, they do caregiving for me all the time. I drop things, they run up and get things for mommy so I don't have to get in my chair and move. They do a lot of just physical, orthopedic kind of things just to help me as well. My daughters open the door for me so I can get through the doors. And so you see them becoming caregivers at a very young age, and they're 6 and 9.
It's almost by osmosis, right? They know they kind of want to help, right?
They know they want to help, and they know that they need to help, and they do. But they don't think of it as caregiving, but I rely on them as well.
I want to talk about inclusion in care. The RAND research shows that veteran caregivers often continue to get left out of the veterans' health care, despite the effort by the Elizabeth Dole Foundation and VA through the Campaign for Inclusive Care. Caregivers report that doctors caring for their loved ones often don't inquire about their own needs or ask for their input. What have you heard from your constituents, from fellow veterans, from other caregivers, and what can be done here?
Well, number one, if access is hard for the veteran, it's even harder for the caregiver. And so again, this goes back to the workforce issue. It goes back to the funding issue. And when you start to fund the VA, the first thing is funding the care for the veteran themselves. And then we need to make sure that the resources are there for the caregiver. So this is now the next step, and we barely fund enough for the veteran themselves, and that population is only growing, especially with the PACT Act. So we need to make sure, as members of Congress, that when we talk about expanding access for veterans, that comes with expanding access for caregivers, and we need to address that issue as well. But then I also think that there are challenges when it comes to caregivers who live in areas far away from a VA facility. Even if you wanted to get help to them, there might not be that help available. Again, it comes back to also workforce as well. So I do think that that's one aspect. The other aspect is I think a lot of times the physicians don't know about the resources that are available for the caregivers. So it's not only that they're not asking about what do you need as a caregiver, they may not even know about programs that exist that are available. And this is where having the medical center home is really important within the VA, so that you have a caseworker who knows what all is there, and can tell that caregiver what is there for them and help advocate for them. But that's really more of an exception than the norm, that you find somebody who's that active, who's that proactive. I know the VA is doing their very best to try to do that, but again, it comes to the point where you need somebody to be an advocate within the system.
How much of an education campaign do you think needs to still happen for your fellow lawmakers? Do you think they understand that there is this kind of full ecosystem, that there's veterans care, and that also is inclusive of families of caregivers?
I think people understand it. The question is, are they willing to pay for it?
That's a question for a lot of things these days.
Yes.
All right, let's shift topics a little bit. Whole health. People often talk about whole health as sort of the holy grail for health and wellness, especially for veterans. While it's important to focus on the veteran, why do you think it's also important to focus on the health of the caregiver and the family kind of writ large?
Well, I mean, I'm going to point to the Caregiver Support Program within the VA. The Caregiver Support Program's mission is to provide for the health and well-being, and I think that well-being part is really important for the family, for family caregivers. And I do think that these resources are really critically important. And again, what I say is to caregivers is you got to ask for help. You've got to accept the health. You've got to put yourself first in some instances, because you are there for the service members, for the veterans when they fall down. You're there literally to pick them up, but who's there to pick you up when you fall down? So if you don't care for your whole health, and we don't care for the whole health of that individual, then you lose that resource that we have that's helping to take care of the veteran. And so that it's a whole health, not just for the person, but for that whole family unit.
How do you, let's drill down on that just a little bit. How do you and your family work to achieve that goal and balance, obviously, a very busy schedule, demanding travel, but also family life?
Yeah, it's hard. It's hard. And you have to, at a certain point, set up your fence posts, your guidelines are like, I'm not going to go beyond this, and this is what has to happen. But that's really hard to do for someone. I run my own Senate office, so I set my own rules. That's very different than a caregiver who's working a 9-to-5 job, who's working an hourly wage and trying to take care of the veteran, or even for the veteran who's trying to work outside the home, but needs help to get out the door to get to their job and then come back home at the end of the day, and not to mention childcare. And so it does get, you try to set up the parameters, but you find yourself violating those parameters all the time. And so much more of that burden falls on the caregiver when those parameters are broken over and over and over again, which is why we really have to be cognizant of what can we do to provide more support.
I think one of the things that has really struck me in talking to so many caregivers through the Elizabeth Dole Foundation is also just the lack of community some caregivers have, that they're far away from family. They don't have some of those kind of community structures in place that really help support, people in challenging times.
And if you are working from 5:30 in the morning until the kids are in bed at night, and what you're doing is you're getting up, barely taking a shower, now you're taking care of your veteran, now you're getting the kids ready for school, you're dropping the kids off, you're going to your job, maybe you're dropping your veteran off at their job, and then you're going to pick up the kids, you're going to cook dinner, you're going to do all of that. You don't have time. Right. You don't have time to advocate, right? You don't have time to go and have a social life to meet people who can become that community to help you, because you are just head down grinding through day after day after day. You don't have the time to ask for help, and that's where the VA's program for family support is really important, because you need somebody else to be advocating for you.
I want to kind of project forward a little bit, kind of to the future here as we wind down this conversation. We know the military, it's a family business, right? Meaning that many recruits are from families who have previously served. Unfortunately, our recruitment retention numbers are down. As a veteran and a member of the Senate Armed Services Committee, what role do you think that improved care of our veterans and families could play in helping solve that challenge?
Well, this is why, I really got into this, is because we're not going to get anybody volunteering for our military, and we're not going to get the best, you're not going to get the best effort if somebody thinks, if I get hurt, nobody's going to keep the promise to me. The VAs are not going to take care of me. My wife's not going to be taken care of. My husband's not going to be taken care of. My kids are not going to be taken care of. This is why we needed to do what we've done so far, which is we passed mandatory funding of VA healthcare. We passed a PACT Act. All of these things are America keeping its promise to the veterans, right? So We can't afford for our troops who are in harm's way, who are about to go kick down doors and engage with the enemy, to second guess whether or not, what will happen to me if I get hurt? What will happen to my family if I get hurt? Are we going to end up bankrupt? Am I going to end up losing my quality of life? We can't do that. And so this is really, caregiving, supporting caregivers and supporting the VA and funding for the VA isn't about doing something altruistic. It's not about doing something that you're being, this great humanitarian. It's about the safety and security of our nation. It's about what can we do to keep our military the greatest military on the face of the earth. Well, our troops need to know that they're going to be cared for, that we're going to keep the promise. If we don't keep our promise, we're not going to have those troops.
What can be done? I mean, in terms of that, I mean, this is kind of being forward-looking. You talk about some of the efforts that have been made to make sure that there is that funding, that there is that care that is needed. But do you think that message is getting out to potential new recruits that maybe are making that choice to go into service or not?
Well, I think some of that message is just getting through. The PACT Act is important. The DOD, we push, and we finally passed legislation that I headed up that allows for 12 weeks of paid leave. So when you have a new baby, you can actually take 12 weeks of leave. It wasn't that before. So a lot of those pieces of legislation is showing our troops that, yes, we're going to take care of them. We're going to take care of their families. But we can do more. And they're going to hear from their buddies who've gone out, like, did you get the support that you needed? And if they don't, then they're going to start, second guessing. Do I stay in? Maybe I don't encourage my nephew to join the military.
We are quickly running out of time, but I always like to leave these conversations on an optimistic note because, we got to keep a glass half full. You and I have certainly seen firsthand the divisiveness of politics right now. We're 43 days from the election. The discord here in Washington is strong, I would say, but also around the dinner tables across the country where you can feel this kind of disheartening talk oftentimes when it comes to the nation and its future. But talk to us about this community, military, veterans, caregivers. What gives you hope about the future?
What gives me hope is that I know that they love this country as much as I do. And that's how I approach every day in my job, is I go in and I just assume that the people that I'm working with, that I'm negotiating with, loves America as much as I do. And that is especially true of the veteran community. And that's why I always end up working first with my colleagues who are veterans, because I know they love this country as much as I do. And I just go in with the perspective that they just look at the problem from a different angle than I do. So of course they're going to have a different solution than I do. But at the end of the day, there's so much more that unites us. Love of this nation, willingness to sacrifice ourselves for this nation because they wore the uniform as well. And there's so much more that unites us than divides us, no matter what the political pundits and the forces that want to divide us are. In my helicopter, and these are my dearest friends that I would die for, and they would die for me because they almost did for me. They 2 Trump voters, 2 Hillary voters, and we are still the closest, dearest of friends. And on that day in that field in Iraq, they almost died for me because they risked their lives to go recover my body. And so there is so much more that unites us. We have so much more in common. And it starts, especially within the veteran and military families, it starts with love of this nation. And that's the optimistic part of my everyday.
I love that. I want to end on one final question. One final question for you, which is, you have a room full of caregivers, of advocates, of people who are really invested in changing some of the things and some of these numbers that were found in the RAND study. What's your message to them? What can they do? What should they be doing that can help turn some of these numbers around?
Well, I think advocating with your legislators is really important because as much as we would like to think that all of your electors understand this, they do not understand this. The number of folks who don't understand how the VA system works is amazingly high. And so the education piece is really important, especially with your representatives. So really advocate with them, and then advocate within your communities as well to, because that caregiver's got his or her nose down, grinding out day after day, helping to advocate the community to reach out to that person and build that community to help them is really important as well.
All right, let's give Senator Duckworth
Thank
a
you,
hand.
everyone.
Thank you so much for joining us today.
Thank you.
Wow. Thank you so much, Senator Duckworth and Anna, for that wonderful conversation. It was so refreshing to hear an elected official talk about what's great about this country and what unifies us. Somehow, with this complex program, we are on time, which is incredible. And the reason for that is the exceptional team that I have at the Elizabeth Dole Foundation. And I just want to take a moment to thank the EDF staff who've been behind every part of the program today. So if I could ask my colleagues who are in the room, I know many of them are backstage, just to stand up and let me give you a round of applause. I'm so lucky to work with the best team in the business. So, as I said earlier today, this convening was not solely about identifying the outcomes of caregiving. It was about preparing our response. So to close out the day, I'd like to just set the course on where we go from here. And as I do, I'm so pleased to welcome two partners who will share some exciting news from their organizations. We heard a great quote from the former First Lady today, and I'm so proud to have my friend and partner, Dr. Jennifer Olson, the CEO of the Rosalind Carter Institute, here to share some comments. Jennifer, thanks.
Thank you. I am delighted to be here today because I am reminded of the commitment of two amazing women. Senator Dole and Mrs. Carter were both incredible at listening to the stories. We've heard stories all day today from caregivers, but not just listening to those stories and enforcing that people get them data, because I understand, Senator Dole, your approach and Mrs. Carter's are the same. Get me those numbers, I need those for the Hill. Bringing those stories, bringing that data, and then coming up with big, bold action. What the Rosalind Carter Institute has done for almost 37 years is think about those who are caring for someone who is ill, aging, or disabled, often early on focusing on those with mental health challenges. So it's no surprise today, seeing the RAND report, that we are here and delighted to think about how we can provide our years of learning in serving individuals with mental health challenges and serving and supporting those who are caring for someone who is aging, two issues that continue to plague this amazing community of hidden heroes. But most importantly, I want to ask you all to join me in my commitment to these two incredible women. First, doing everything you can to advocate for the Elizabeth Dole Act and all that needs to happen in the next few weeks to push that through. But secondly, join us in a call that Mrs. Carter made 3 years ago for an Office of Caregiver Health. She asked us all to recognize that today's caregiver is tomorrow's patient. And while I'd love to think that the VA system could serve every one of the caregivers in the room, there is a whole community of other types of care that happens in communities, in hospitals, with Medicare, with Medicaid. We need the whole federal government to have the level of commitment and championing that happens here in this room with all of you. So I'm asking you to join us. We will commit to doing everything we can to further the work of the VA, shine a light on the great example of all the things that have happened, but join us in helping think about and supporting all of those caregivers, creating that Office of Caregiver Health, and again, supporting today's caregiver so they don't become tomorrow's patient. Thank you.
Please welcome to the stage President and Chief Executive Officer of the Military Officers Association of America, Lieutenant General Brian T. Kelly.
Well, good afternoon. First, let me say thank you to Senator Dole and the Elizabeth Dole Foundation for the incredible work you do, and congratulations on this convening event that you've had. It's just fabulous, and it's just my honor to be here at the end of this. I am just absolutely thrilled at MOA to be partners with the Elizabeth Dole Foundation, and we've been partners for a number of years on legislative issues, and we work together tirelessly on a caregiver's guide that we put online and we continue to work on together. And so this partnership is just really incredible. We at MOA, and let me just say a little bit about MOA, the Military Officers Association of America, we are the largest association of military officers in the country, and we are united about this. We believe our voice allows for a strong national defense, and specifically that the people who make strong national defense possible are the people who need our support. And so the 350,000 members of the Military Officers Association of America for 95 years now has been dedicated to preserving and protecting the earned benefits, the benefits that all of you earned for those folks who are currently serving, those folks who have served, their families, the survivors, and the caregivers that make all of that possible. And so MOA has been doing that for a while for all ranks across all uniformed services. And today I'm happy and thrilled to be here to announce there's an opportunity for us to expand our partnership with the Elizabeth Dole Foundation and take this to an even higher level. On October 28th and 29th of 2025, about 13 months from now, so a little bit out, MOA is going to be hosting a conference that we call the Total Force Plus Conference. It is a people-first conference that is designed to bring in key decision makers from the Department of Defense, from the VA, and from the Congress, and unite them in a forum with key stakeholders like yourselves and folks who have solutions to take care of and work on the most pressing problems we have across the military and veteran community. As you heard Senator Duckworth just talk about, there is a tie, if you will, between the currently serving folks, the transitioning folks, and our veteran community that has to be sustained. The experience that you have while you're serving, while you're transitioning, and after you served as a veteran, and the families, the caregivers, the survivors, matters to whether the next generation of folks will volunteer and will serve for our nation. And so we believe this conference will give us an opportunity for you and for others to work on the things that you guys talked about here at your convening, but to take on those tough challenges and advance solutions to those most pressing of problems. So again, I really want to thank the Elizabeth Dole Foundation. I want to thank the opportunity for us to continue that partnership, and I want to invite all of you to join us next year, 28th and 29th of October 2025, not too far from here, over at the Gaylord National in National Harbor, where we put on this two-day event, which we really think will help us all advance the solutions to those problems that are really pressing for our military and veteran community. So thank you again for giving me the opportunity to be here. Thank you, Senator Dole. Congratulations to you all, and have a great night.
Okay, many thanks to RCI and MOA for standing with us to deepen their support for caregivers. A couple things. We're about to have a reception. Can't get my words out. It's the end of the day here. So we invite you all to stay and have some refreshments. We also want to let folks know that tell your family at home, but we'll be on PBS NewsHour tonight. Specifically, my board chairman will be on PBS NewsHour tonight talking about the RAND study. We thank our friend Amna Nawaz for taping that and recording that interview yesterday to talk about the study. Rajiv, we're going to get it all out across the country now, right? So our first step is talking to a great news outlet tonight with our friends at PBS who help us dissect information like no one else. Tomorrow, for those of you who would like to join us, we'll be in front of Congress. I will testify, as will Rajiv, and a number of caregivers, our friends at ARP, Wounded Warrior Project. We're going to take this message that we've conveyed today to Congress. And most importantly, we're going to have all 65 of our Dole Caregiver Fellows and alumni in that audience behind us while we talk to members of Congress about what they got to do next. So come on down to Capitol Hill or tune in, but that's going to be happening tomorrow. In the coming weeks, we're going to be forming working groups. Everyone's favorite thing to do, right? We're famous for this at the Dole Foundation. We did this after the last study, and it was incredibly successful. One dedicated to each pillar that you heard about today that's designed to bring our stakeholders together across sectors and continue this dialogue in a much more detailed way. Fortunately, I have a great new COO, Elizabeth Field, who you saw earlier, and her team, who've already done a great deal of thinking about how we're going to structure this and engage our stakeholders across those pillars. We have friends from Booz and KPMG and others who are helping us think about how we're going to organize those, and we all need all of you now to begin to let us know when and where you want to serve in and among those working groups. We invite folks from all sectors to be part of us putting together this blueprint that we're going to execute over the next couple of months and years. I know we can do this. It's going to be tough. It's going to be hard. We heard a lot about the issues facing our constituents today, but we've done this before. We've done this over the last decade. So I want to thank you all for being part of this really banner day in our movement. A special thanks to our sponsors and partners who made it all possible. And now, let's have some fellowship and take a break from the substance, let our shoulders down, and have some fun. Join us at the reception outside, and we'll be together. Thanks all for coming. Could we have